Good morning and half a day. The Committee on General Government Operation, Appropriation, Housing is now called to order. For the record, today is Thursday, May 20th, and the time now is 9:32. Notice for this budget hearing was disseminated via email to all senators and all main media broadcasting outlets. First public notice was issued on Monday, May 10th, and then followed by Thursday, May 13th, and today is Monday, May 17th. And Monday, May 17th. The committee will hear and accept testimonies on Bill 55-36 COR, the Fiscal Year Appropriation Act as requested by the Governor, relative to the Department of Public Health and Social Services for fiscal year 2022 budget requests. Joining me for this budget hearing we have Speaker Therese Terlai, the Oversight Chair of Health, and Vice Speaker Tina Rose Munoz-Barnes. We have Senator Joanne Brown, Senator Mary Torres, and Senator Tello Taitigui. I know that my other colleagues will be joining us shortly. The rules for this budget hearing, those testifying on behalf of Bill 55-36 COR relative to the Department of Public Health and Social Services are provided to the panel. We have this morning the Director, Art Agustin, Deputy Director, Loren Duenas. We have Terry Uggan, and we have Tommy Taitigui. Written testimony shall be submitted to the committee. Please provide my legislative staff with your written testimony for photocopying. Testimony may be read, and lengthy testimony shall be summarized to about 5 minutes. But for this hearing, we'll allow public health. You have all morning. I'm hoping we won't last all morning, but you'll be able to present. You have slides. I know that you wanted to be part of your presentation. Those testifying will be allowed to present oral testimony. Once you're done, I ask that you remain in the room for questions or for additional testimony as may be desired by the members of the committee. Questions and testimony shall be confined to the substance or nature of the agenda, which is the budget of public health. Personal inference as to the character or motive of any senator or any individuals testifying is not permitted. Any violation of the general rule of conduct will result in removal from the public hearing room. Proper form and decorum shall be practiced by all present in the public hearing room for these proceedings. Individuals who fail to maintain proper form and decorum may be restricted from providing oral testimony and may be asked or will be escorted from the room. When you speak, please make sure that the microphone is on and that you speak into the microphone. For the purpose of this budget hearing, questions or comments from the Committee on Appropriations will be given. We're not going to go any rounds. We're just going to allow a full-blown hearing on this. If there are any questions that my colleagues poses to the panel and aren't able to answer, I would ask the department to please provide a response. Please state your name and your title for the record. At this time, I ask the panel members from the Department of Public Health and Social Service to rise and for our Sergeant at Arms to please swear them in.
Kindly raise your right hand. Under penalty of perjury, do you all affirm that any and all information that you provide today, whether verbally, electronically, and in written writing, to be the truth, the whole truth, and nothing but the truth, so help you God? Mr. Chair, they're under oath. You may proceed.
Thank you, Sergeant at Arms. I will now ask the Director, Art Agustin, to proceed. Please begin to discuss or present your budget for 2022. And I'm been advised that you have slides you want to present. If we have the folks be able to present the slides on the, but first, Art, are you ready?
Yeah, we're going to. I'd like to provide a narrative first before we start with the presentation of the PowerPoint, Senator. Buenas, good morning, Speaker Terlahi, Vice Speaker Munoz-Barnes, Committee Chair Senator Agustin on General Government Operations, Appropriations, and Housing, Senator Joanne Brown, Senator Tello Taitigui, and Senator Mary Torres. I'm Arthur Agustin. I'm the Director with the Department of Public Health and Social Services. And as the Senator has already listed those members of my department who are with me this morning, I'd like to do that again. I have my deputies with me, Deputy Terry Uggan, Deputy Lori Duenas. I also have my Administrative Services Officer here with me this morning, Mr. Tommy Taitigui. Given the largeness of our department and the many programs that we operate and administer, I also have staff in our lobby, or in your lobby, I guess in our lobby, from the various divisions that are ready to come forward to provide additional information for the senators should you have questions of the department. So from the Division of Environmental Health, we do have the acting administrator, Marilu Scruggs. With her is Rosanna Robigo, Remy Suva, and Jeffrey Pinella. From the Division of Public Welfare, the chief of the division, Task Archangel. The Division of Public Health, we have the acting CPHO, Chima Mbakwe. We also have with him this morning Annette Uggan, Estelle Ada, Darlene Titano, and Patrick Soto. With the Division of Senior Citizens, we have Charlene Nicholas and Evelyn Manibusin. Members of the 36th Guam Legislature, the mission of the Department of Public Health and Social Services is to assist the people of Guam in achieving and maintaining their highest levels of independence and self-sufficiency in health and social welfare. The department serves the people of Guam and accomplishes its mission by establishing and enforcing standards, licensure requirements, and regulations necessary to ensure health and safety of the public, conducting surveillance and monitoring activities necessary to ensure the prevention and early identification of health and social problems, providing services that address identified health needs, focusing on prevention, early detection, and treatment of health problems that are accessible, available, and affordable to the target population, providing information and opportunities needed to make informed decisions about the lifestyles and well-being of the people of Guam. Developing programs to strengthen public, private, and traditional community supports and resources to ensure residents maintain a minimum standard of living, to strengthen family life, and to encourage economic self-sufficiency and preparedness. Promoting programs that foster growth and independence of Guam's residents across the lifespan, providing leadership and direction in the areas of environmental health, consumer protection, communicable disease prevention and control, Medicaid, medically indigent program, foster care, services for the elderly, supplemental nutrition assistance program, and various other public health and social services programs. Within the department, there is the Division of General Administration. As with any organization, there requires a team to support the overall operations of the agency. To this end, we have administrative, fiscal, and human resource components that are necessary to support our department's effort to provide health and social welfare services and programs to our community in our continued effort to build workforce capacity, systems that are lasting, promote quality improvement, and refine our systems to be an integral part of our daily operations. We are realigning our resources to build the capacity of our business office or our fiscal operations, developing our human resource office to be more than just one person and one assistant, and an emerging grants management office. In addition, we are in need of a safety officer and an equal employment officer to add on to our administrative team. We are proposing to hire staff to enforce safety policy, conduct workplace safety inspections, investigate accidents, train staff at the workplace to ensure safety measures are adhered to, as well as having another staff responsible for enforcing federal laws that make it illegal to discriminate against a job applicant or an employee because of the person's race, color, religion, sex, national origin, age, disability, or genetic information. The Division of Senior Citizens is one of 5 divisions of the department. It provides a multitude of home and community-based services to keep seniors engaged in their communities and to prevent premature institutionalization. It is a fundamental principle that older people and people of all ages with disabilities should be able to live where they choose, with the people they choose, and with the ability to participate fully in their communities. Aging programs and service provided through funding from our local government and the Administration for Community Living, U.S. Department of Health and Human Services, is authorized through the Older Americans Act of 1965 as amended. The Guam State Office on Aging provides 20 programs and services either directly or through contract. Title IIIB supported services includes adult daycare, case management, in-home services, legal assistance services, senior center operations, and transportation services. Title IIIC includes elderly nutrition, C1 congregate, and C2 home delivered meals. It also manages the Title IIID preventive health, Title IIIE National Family Caregiver Support Program, Title VII Elder Abuse, and Title VII Ombudsman, the Adult Protective Services, that includes a 24-hour, 7 days a week crisis intervention hotline, and Guma Serenidad, a protective shelter for adults with disability ages 18 to 59 or seniors age 60 and older. It also manages Senior Citizens Month, information referral and assistance, State Health Insurance Assistance Program, the Senior Medicare Patrol Project, Aging and Disability Resource Center, the No Wrong Door Initiative, and Nutrition Services Incentive Program. Just a sampling of a little in terms of their client data provided under Title III services. There were registered clients in FY20 of 4,342. That's 4,342. In comparison to the FY19 of 3,379, it was a 28.50% increase of registered clients. Also, with our clients with 3 or more impairments of activities of daily living, in fiscal year 2020, we saw 1,713 in comparison to FY19 of 1,412. Again, an increase there of approximately 21.32%. Our congregate meals, which many of you are very aware of, we provided 198,950 meals in fiscal year 20. In comparison to the FY19 data, we served 132,117. Also in our case management services, which is critical to those referring and coordinating services for our seniors, they provided 18,153 units of service in FY20, and in FY19 it was 12,421. Again, an increase in FY20. Aging services funding from January to present. The reduction of our local overmatch in 21, this fiscal year shortfall, anticipated for period January 2021 to March 2021. The shortfall was provided through the available fiscal provisions. Otherwise, aging services would have been suspended in December 2020 due to the budget shortfall and reduction in 21. The grant funds that were obligated and available for a 2-year period in FY20, and due to the decrease in services, resulted in funds in FY20 being available for us to use in FY21. So these funds were not liquidated. They are 2-year grants, so we were able to carry them into FY21, the current fiscal year, to augment the funding for the services this FY. The disaster declaration by both Guam, our governor, and the president enabled Title III bucketing funds. This includes traditional and additional grant funds. Basically, funds this year could be used across all programs. Public Law 35-119, in which $470,000 was appropriated to the department, was given to the Division of Senior Citizens and supported the Title IIIB overmatch, our supported services, and the Bureau of Adult Protective Services. We want to take a moment to thank the Chair on Senior Citizens, Senator Shelton, Legislative Secretary, and of course the support from our Vice Speaker, Senators also Nelson, Agustin, Torres, Adam, Tidegui, and also extend our appreciation to Speaker Talai for joining us on the opening of our Elder Justice Center on May 3rd, 2021. So we thank you for the support of the passage of 3619. The division manages a multitude of program services that support seniors, their caregiver, and their families, maintain our seniors in our community for as long as possible, for seniors to age in place. It is through the home and community-based services, the programs of the Division of Senior Citizens, provided directly or through contracted providers, that seniors and caregivers avail of formal support systems that allow them to better manage their lives in the form of protection and advocacy, access to care and services, mobility within the community, a balanced meal, coordination of care, and assistance to navigate through the Medicare maze. I'd like to move on to the Division of Public Welfare. Administers several major public assistance programs such as Medicaid, Supplemental Nutrition Assistance Program, Cash Assistance Program, to name a few. And their efforts are there to support low-income individuals and families who are in need of health care, food, shelter, and child care services. The fiscal year 2020 DPW, Division of Public Welfare expenditures, was $313 million. Of this amount, 96% or $302 million was for benefits and payments issued to program clients and providers. 3% or $8,185,766 million was utilized for personnel expense, and 1% or approximately $3,065,000 million for other operational expenses. Additional payments made and information on the Division of Public Welfare. They provided services to more than 56,000 clients, processed more than 228 claims from providers. They issued $85,119,851.65 in SNAP and $2,011,226.71 in client assistance payments. These are benefits that were processed. We also paid out $5,761,266 for Child Care Development Fund payments to our child care providers. Our Medicaid claims paid out was $69,759,642, and our MIP claims paid out was $8,171,243.77. The Guam Medicaid program is really statutorily at 55%. And we want to bring this up because this is one of those programs that the matching requirement fluctuates. So in 2020 and 21, fiscal years 2020 and 2021, Guam's FMAP was 83%, but as a result of COVID-19, Guam received an additional 6.2 increase, which brings our match to 89.2. In general, Guam must contribute a non-federal share of the applicable match rate in order to utilize these federal funds. However, Congress has at times made some supplemental appropriations available at 100% with no matching rate. So therefore, from January 1st through September 30, 2019, it was 100% covered by the Medicaid program. Congress has not made any additional funding after FY21, which means that for FY22, we're reverting back to Section 1108 when we're expecting 19 to 20 million prior to the passage of the Public Law 11694. An ongoing fiscal challenge of this program is to determine the amount needed to match Medicaid federal funds without knowing the percent of Guam's required match. Unlike other programs, their match levels have remained constant for years, which allows for better fiscal planning and decision-making. We'll now move on to the Division of Environmental Health. The mission of the Division of Environmental Health is to serve and protect the people of Guam from environmental hazards and drug diversion through education and the implementation of governing laws designed to prevent injuries, diseases, and deaths. DEH operates through the mandates of 23 statutes of Title 10 enacted for the prevention and control of public nuisances, mosquito control, indoor smoking and littering, along with regulation of health-regulated establishments and consumer commodities. In addition, through the authority of Title 9 GCA Chapter 67 of the division has a responsibility of preventing the diversion of pharmaceutical controlled substances. DEH operates through appropriations from 3 special funds: the Healthy Futures Fund, the Environmental Health Fund, and the DPHSS Sanitary Inspection Revolving Fund. Revenues are generated through issuances of health certificates, sanitary permits, and H-2B fees. Additionally, 6 grants help support the division's program's activities. The COVID-19 emergency declaration in March 2020 adversely impacted DEH's revenues from health certificates and sanitary permits, with a prohibition of directing non-essential businesses and places of public accommodations to cease operations. DEH issued 19,491 health certificates in FY20 compared to 27,021 health certificates the prior year into FY19. This resulted in a difference of 7,530, or a 27% decrease in health certificates being issued. The revenue from health certificates in FY20 was $445,000. In FY19, the revenue was $607,577,000, a reduction of $162,577 in FY20. Sanitary permit revenues reflected a similar pattern. In FY20, DEH generated $792,231,000 for sanitary permit fees, compared to FY19, which totaled $892,627, a loss in revenue of $100,396. In terms of sanitary permits being issued, DEH issued 2,937 permits in FY20 and 3,385 or 3,385 permits in fiscal year 19, a reduction of 448 permits. The Guam Controlled Substances Registration also saw a decrease of 32,500 from FY20, which generated $217,150 compared to FY19 revenues of $249,650,000. In FY20, DEH issued 451 CSRs in comparison to the 515 issued in FY19, a difference of 64 fewer CSRs issued. In summary, based on the combined revenues from health certificates, sanitary permits, and CSRs, the division had a total loss in revenue of $295,473 in fiscal year 20. Throughout our COVID-19 emergency, the Division of Environmental Health serves a critical role excuse me, in protecting the health and safety of our people by ensuring compliance with the Governor's executive orders and this department's guidance memoranda. DEH activities included conducting compliance inspections of all businesses, not just limited to those health-regulated establishments that DEH regulates, providing consultation to government departments and agencies, businesses and organizations to maximize the number of authorized occupants and advice on the proper cleaning and disinfection of surfaces. Reviewing COVID-19 business mitigation plans for approval, preparing DPHSS guidance memorandum for director's approval, my approval, responding to complaints of congregation, social distancing, wearing of face masks, and lack of COVID-19 mitigation plans and customer login record. Issuing Guam uniform complaint and citation tickets for violations of COVID-19 public health enforcement regulations. From March 2020 to present, DEH accomplished these significant activities, conducting 4,593 COVID-19 compliance inspections and 1,577 sanitation inspections, prepared a total of 67 DPHSS guidance memoranda as a result of updates to the Governor's executive orders, with corresponding guidances issued to food establishments, schools, child care facilities, places of worship, gymnasiums, cosmetic establishments, sports, and special events such as graduations. Reviewed 1,394 business COVID mitigation plans and issued 13 citations for violations of the COVID-19 regulations. We'll move on to our Division of Public Health. The Division of Public Health is charged with working toward the prevention and control of disease and for promoting health throughout Guam. Managing approximately 72 mandates, the division provides physician services at our community health centers. Today, as the Central Public Health Site is no longer operational due to the November 29 electrical fire. The health services provided through this division is geared towards our residents who are medically and financially in need. The division conducts surveillance and monitoring activities to prevent and or identify health problems in our community. Also managing Guam Cancer Registry through the Office of Epidemiology and Research to collect information on all cases of cancer occurring within Guam. The same office is responsible for conducting epidemiological studies and for the investigation of diseases or conditions that pose a threat to public well-being, and for recommending preventive and remedial actions to include compilation, analysis, and distribution of statistical data on diseases. Through this office, proposed policies, regulations, and laws could be made that are necessary to protect the public from the spread of communicable and other health-threatening problems. Another component of this division is the operation of the Office of Vital Statistics that issues birth and death certificates and marriage licenses. The Bureau of Communicable Disease works to prevent and control communicable diseases by working with providers and laboratories in the timely reporting of communicable diseases, conduct prompt investigations, increase immunization rates for vaccine-preventable diseases, increase TB preventive therapy, HIV testing, build laboratory capacity, provide X-ray services, collaborate with health centers in providing comprehensive family planning and related preventive health services. The Bureau of Nutrition Services provides nutrition education, consultation, in-service training, and counseling, and manages the Women, Infants, and Children WIC Farmers Market Nutrition Program and the WIC Breastfeeding Peer Counselors Program. Along this effort to promote health, the Bureau of Family Health and Nursing Services focuses on providing services to hard-to-reach individuals and families not adequately or appropriately serviced by traditional healthcare delivery systems. The division also works with children and their families using the child-centered and family-driven, community-based, and culturally and linguistically competent approach in the delivery of services. The children served are those at risk for social, emotional, or behavioral concerns and their families. The Division of Public Health administers a range of programs that monitor and support public health initiatives for a healthier lifestyle, tracking lifestyle habits, managing non-communicable diseases like diabetes, managing detection programs, and health promotion programs. The greatest challenge of the division, the department, is responding to its COVID-19 pandemic. The pandemic has called upon resources throughout the department to mitigate, investigate, and manage the pandemic. Many employees throughout the department were assigned and continue to be assigned to respond to the public health crisis. The one social worker is now managing daily operations at a quarantine facility. Our environmental health staff are now adding on to their workload for compliance as COVID compliance officers, along with other DPHS staff who have joined this effort. Our nurses are now managing multiple vaccine sites, staffing airport operations, all in the effort to control the spread of the virus, and the effort to identify positive cases to be placed in isolation to slow and stop the spread of the virus, and to vaccinate Guam to reach herd immunity. And as we transition from programs and services, and before we go to the fiscal part of our presentation, I'd like to again further share that DPHSS is one of the major providers of health and social services to the island residents through welfare benefits and programs such as Medicaid and MIP, the licensing of child care facilities and foster care homes, protection and advocacy of children and adults, the issuance of health certificates, sanitary permits and controlled substance registration, primary health care services, health promotion and disease prevention of non-communicable diseases, issuance of birth and death certificates and marriage licenses, prevention and control of communicable diseases, services for women, infants, and children, and home and community-based service for seniors to age in place in our community, in their community. I, along with the staff and management of DPHSS, request your fiscal support of our FY22 budget of $36,522,726 in general fund and $16,990,336 in special funds, for a total of $53,513,062. In addition to the funding request before this body, I've also submitted a request in the amount of $17,883,560,000 for under the American Rescue Act funds for fiscal year 22 operations. Further, we ask for the following provisions to be considered of this body. No application of the 15% reserve to any funds appropriated to DPHSS in fiscal year 22. Rollover of lapses from general funds and all DPHSS special funds. And the third item we ask for the body's consideration, in addition to the first two mentioned, is really to consider providing a fiscal provision for funds earmarked. For example, Medicaid. The department have the flexibility to transfer funds after a determination has been made by the managing program staff and the division administrator that there will be a lapse that can be used to support other DPHSS operations. Otherwise, funds in that group will then lapse to the next fiscal year, and again, we ask that that be carried over. At this time, I'd like to ask that we now move to our PowerPoint presentation.
Yes, Mr. Hart, that was a mouthful. Basically, your last paragraph of your first presentation is, you're basically asking for a lump sum budget, correct?
Yes.
Okay.
Test.
Please proceed on with your presentation now for specifically FY 2022. Thank you, sir.
Thank you.
First slide here is to provide our overall mission, and that overall mission of the Department of Public Health and Social Services is
Tom, identify yourself so everybody knows and the public will know who you are.
Okay.
Thank you.
My name is Tommy Taitugui. I'm the Administrative Services Officer for the Department of Public Health and Social Services. This first slide, I just want to provide the overall mission once again. And the mission of our department is to assist the people of Guam in achieving and maintaining their highest levels of independence and self-sufficiency in health and social welfare. I've also listed the names of the individuals tasked to lead the department and the divisions. Arthur San Agustin, our director. Laurent Dueñas, our deputy director. together with Terry Uggan, our Deputy Director, myself, Tommy Taitugui, the Acting Chief of the Environmental Health Division, Mary Lou Scroggs, the Acting Chief Public Health Officer of the Division of Public Health, Chima and Bakwam, the Acting Senior Citizens Administrator for the Division of Senior Citizens, Charlene D. Nicholas, the Chief Human Services Administrator of the Division of Public Welfare, Teresa Archangel, better known as Tess Archangel. Next slide. This provides for a breakdown of our organization. Falling under the director and the deputy directors, we have the Division of Environmental Health, the Division of Public Health, the Division of General Administration, the Division of Senior Citizens, the Division of Public Welfare. Next slide, please. This is a breakdown of the proposed request coming from the general fund, and it provides for $36,522,726, and is broken down into public health operations being at $7,073,693. For MIP payment revolving fund, we have $11,047,503. MIP cancer screening treatment and support services, $760,453. Local match for the Medicaid program, what's being requested is $6,662,373. For local match for the CHIP program, the CHIP program is the Children's Health Insurance Program, is $4,285,099. Local match for programs for the aging is $641,352. Local match requested for public assistance payments is $3,160,125. Local match requested for the Enhanced Allotment Plan, better known as EAP, that's now included with the Medicaid program, is $1,149,288. For insurance premiums for foster care children, $665,396. For child protective services, $114,068. For the medical marijuana lab, it's $202,923. And for the foster care group home, $760,453. And they all amount to the total again of $36,522,726 coming from the general fund. Next slide, please. A breakdown of what's being requested from the special funds is provided in this slide and amounts to a total of $16,990,336. And what's made up of this is the request for coming from the Environmental Health Fund in the amount of $1,352,560. From the Healthy Futures Fund, the Public Health and Social Services Operations, in the amount of $6,061,138. From the Sanitary Inspection Revolving Fund, $115,906. From the Guam Board of Medical Examiners, Health Professional Licensure Office Revolving Fund, $252,782. From the Office of Vital Statistics Revolving Fund, $236,960. From the Healthy Futures Fund for local match for our Medicaid program, $5,951,746. From the Healthy Futures Fund, Guam Cancer Registry, $389,144. And then from the Healthy Futures Fund for the MIP Payment Revolving Fund, from the MIP Payment Revolving Fund, is $2,630,100 for a total in the amount of $16,990,336. Together with this total from the special funds, right, and the general fund request in the amount of $36,522,726, provides for a total local request of $53,513,062. And the federal portion of this request, should we be provided the amount, is $44,542,008. This provides for an overall total for public health in the amount of $98,055,070. I just want to briefly mention that I know we have the budget digest that indicates the $16,601,192. That's not inclusive of the Guam Cancer Registry. So really when you add the two, it comes out to be that $16,990,336. Next slide, please. What's provided here is that $98,055,070 is broken down by division, and for the good portion of that amount, or 84%, it's going to be provided for the Division of Public Welfare, coming in at $82,079,886. The next portion, the largest portion of this amount is being provided for the Division of Senior Citizens, and it provides for 6%, or $6,269,994. For the Division of General Administration, 5%, or $4,567,932. And then for the Division of Public Health, $2,930,793, or 3% of that portion. And finally, for the Division of Environmental Health, the request is $2,206,465, or 2% of that portion. Next slide, please. $98 million in this slide is broken down into the fund. The general fund provides for 30% of that $98,055,070. The general fund provides for, the amount requested from the general fund is $36,522,726. Again, that was like 37% of that total amount. And then from the Healthy Futures Fund, $15,032,128, or 15% of that total amount. And for the Environmental Health Fund, from the Environmental Health Fund, $1,352,560, and that's 2% of the overall total. The DPHSS Sanitary Inspection Revolving Fund, their request is $115,906, and that comes in at a fraction of a percent. Together with the HPLO Revolving Fund, and it comes in at $252,782. For the Office of Vital Statistics revolving fund, the amount identified is $236,960. That is also coming in at a fraction of a percent of that total. And then finally, the federal grants and aid that we receive, or for the federal portion of the money we receive, amounts to $44,542,008. Next slide, please. This provides for, the slide presents the shortfalls that's also being requested by the American Rescue Plan in the amount of $17,883,560, and is broken down into the different divisions. For the Division of General Administration, what's being requested from the American Rescue Plan is the amount of $362,707, and that would augment the request coming from this budget of the request being $4,567,932 for an overall total budget requirement of $4,930,639. For the Division of Environmental Health, there's a shortfall and requests in the amount of $2,957,715 to augment what's being requested in the budget of $2,206,465 for a total requested or required budget of $5,164,180. For the Division of Public Health, what the shortfall amount and what's being requested is $1,187,026. Together with together with what's requested in this budget, it's $2,930,793 for an overall total budget requirement of $4,117,819. And for the Division of Senior Citizens, $7,048,218 is what's identified as the shortfall and also being requested through the American Rescue Plan to augment their local and their federal grants and aid amount of $994 for an overall total of $13,318,212. And then finally, what's being requested and what's identified as a shortfall in the Public Welfare Division is $6,327,894 to augment what's provided from the local and federal grants and aid in the amount of $82,079,886 for an overall budget requirement of $88,407,780. And when you add what's identified as a shortfall and also what's requested from the American Rescue Plan to the $98,055,070, you have a total of $17,883,560 for an overall total of $115,938,630. Next slide, please. Of all the COVID-19 grant awards awarded to the department that would carry us forward to the fiscal year 2022, next upcoming fiscal year, we've identified a total thus far in the amount of $513,633. And I show a breakdown of that amount respective to how it was awarded or where it was awarded, with the bulk of the amount being awarded to the Child Care and Development Block Grant Program. And that amount comes in at $94,158,000 or $159,366.60. That comes in at 74% of that $126.5 million. The next program that we have is the Epidemiology and Laboratory Capacity Program. They have total awards currently in the amount of $19,986,233.27. That's 16% of the total, the $126.5 million. For the senior citizens programs, for the programs for the aging, we currently have $4,733,605 that will carry us into the next upcoming fiscal year. That comes in at 4% of that total, the total of $126 million. For the immunization program, what's awarded is $4,410,096, and that's the award amount to date is provided through FY22. For the healthcare centers, I'm going to take that. I just want to explain real quick. These amounts are the amounts currently available that will provide for us through FY22, and not necessarily what's been provided in total. In the health centers program, we have currently $2,450,054.27. That's 2% of the total $126.5 million. For the Public Health Emergency Response Program, we have $709,585.43. That's coming in right below 1%. And then for the SNAP program, the Supplemental Nutrition Assistance Program, what's provided is $64,692.34. What's currently available is $64,692.34, and that comes in at a fraction of a percent. Next slide, please. This is a breakdown of, it's just a breakdown of our personnel within the department. In total, as of I believe March, and from information provided through the Human Resource Division, the Department of Administration, we currently have 507 employees. And the breakdown of these employees by division is as follows. The Division of Public Health employing 321 individuals, or 63% of that amount. Next would be the Division of Public Welfare employing 137 of the 507 individuals. And then we have the Division of Environmental Health. They employ 22 individuals from the 507. The Division of General Administration, 16 individuals. The Division of Senior Citizens, 11 individuals. Now the breakdown in the blue graph there is a breakdown of our classified employees. Of the 507, we have approximately 358 classified employees. 182 of them are being employed under the Division of Public Health. For the Division of Public Welfare, we identify 135. For the Division of Environmental Health, 22. For the Division of General Administration, 11. For the Division of Senior Citizens, 8. And these are of the 358 classified employees. And when we break down the unclassified employee amount, the number of employees in the amount of 149, the bulk are employed with the Division of Public Health in the amount of 139 individuals. We have, with the Division of General Administration, 5 unclassified employees. With the Division of Senior Citizens, we have 3 employees. And then we have, within the Division of Public Welfare, 2 employees, which amounts to 149. To further just identify or let it be known that we have 98 employees, or approximately 19% of our workforce, that are eligible for retirement. 13 of the individuals they fall under the non-base defined benefit retirement plan, and the defined benefit plan provides for 16 of those individuals. I mean, the 98 individuals. And then with the defined benefit plan is 21 individuals. And with the defined contribution plan, 48 individuals. And here's a breakdown of the length of service of 25 years and above. For 25 years, there's 9 employees. For 26 years, 11 employees. 27 years, 9 employees. 28 years, 12 employees. 29 years, 14 employees. For 30 years, 15 employees. For 31 years, we have 5 employees. For 32 years of service, we have 7 employees. For 33 years, 6 employees. And then for 34 years, we have 3 employees, followed by 35 years with 2 employees, 36 years with 4 employees, 38 years, 2 of them. And then we have 1 individual that's worked 42 years, and 2 individuals that's worked 43 years. And then finally, we have the breakdown of classified employees and their discipline, by discipline. For general staff, we have a total count of 129 employees. For administrative staff, of the 358 employees, we have 41 administrative staff. For the professional staff, non-supervisory, we have 110 staff. For supervisors, we have 35 supervisors, 13 administrators, for a subtotal of 328. And if you include the medical staff, an additional 30, for a total of 358 employees. Next slide. And this is what I've just presented. Sorry. And then finally, the next slide. Sidus Masi.
Thank you, Art. Thank you, Tom. Trying to digest everything you presented. And just looking at the tail end, Art, Mr. Snauxing, on the personnel side, you identified 98. You could lose 98 folks. You could lose a lot of institutional knowledge out of public health. But I'm trying to look at what are you asking for? If you have the positions that are funded, you're not asking them to be filled because we're going to fund the current positions. So if you need to fill them, 98 you can fill.
Right.
Okay? I don't think you're going to have a restriction.
Right.
I was just trying to follow along with how it's being presented. What is your number of vacancies you have? When I look at the list, what's your total vacancy today?
Just a second.
Not counting the pending possible retirement, okay? What are your total vacancies? Just vacancies, total.
Right. So the test. So the total funded positions that are vacant right now is 114.
No, what are your total vacancies? 114 vacancies?
114 funded vacancies. Those are funded vacancies. We have some of them at DOA and some of them have yet to be processed. So that's what we have is 114 funded vacancies. Total number of vacancies we have is 194. 114 are funded and 80 are unfunded.
You have 194 and 104 is funded?
114 is funded and 80 of the 194 is not funded. So in our staffing pattern, we'll have a list of positions with assigned position numbers, and based on our ceiling year after year, we'll fund those positions that are, of course, warm bodies, and then if there's additional funds available, we will then fund those positions that in most situations, the administrators will determine which of those positions that are vacant need to be funded for the operations of their respective programs and their divisions.
Okay. I'd like to also recognize my colleagues that have joined us today. We have Majority Leader Senator Talina Nelson, Minority Leader Senator Chris Duenas, and Senator Sabina Paris. I'd like to ask the Oversight Chair, Madam Speaker, if you have any questions to the panel, because I know that you wanted to bring in tests probably, so I would ask probably as we go through, Art, we may have to ask one of the panels to step out so we can bring Tess in as the speaker goes through her questions. So, Speaker, please.
Well, yes, first of all, I'd just like to clarify, because according to the budget comparison in front of us, I think they passed that out to you as well. This is prepared by the Office of Finance and Budget at the Legislature. It's called FY22 Budget Comparison. According to this, so you are requesting $17 million less from the general fund than you received in FY21. Is that correct? It doesn't seem to, well, it's not reflected on your it matches the amount you're asking for on your slideshow was 36 million. So that's what this also says, 36 million is what you're requesting for FY22, but it shows that in FY21 you received 53 million from the general fund. That was your authorized appropriation. That would be a $17 million less. That's coincidentally the amount you're asking for from the ARP funds. So I want to know if this is correct, why aren't you asking for that from the general fund at this? I don't understand that. If OFB could also make sure I'm saying this correctly. Could we also, while they're figuring that out, I'd like to know what the governor's request was for public health from the general fund.
But she's checking.
I guess
Madam Speaker, yes, in consulting with my ASO, you are correct in that in FY21 we had 53 million, and you are correct in that the 22 request is 36 million. Yeah, and these amounts were, as of every fiscal year, based on the projected revenue, we're given an assigned ceiling, and we work with that. And so you are correct that for this year in the general fund, the assigned amount to public health is 36 million, which in your estimate was about 17 million short. And yes, we are requesting that through the American Rescue Plan Act.
It's just that we haven't done the budget yet, so you don't have a shortfall yet. you should be asking for what you need. It should be, if you needed it last year and you still need it,
Yes, we do.
but it looks from your documents that you need 36 million. That's what you are requesting from the legislature today, 36 million, 17 million less than what you received last year. That's just perplexing to me. I can't understand it. We can't count on ARP funds that it's going to be allocated to public health. And public health, I mean, it was a big, huge controversy last year about the funding for public health, and now you're coming in and asking for 17 million less, at least in general fund revenues. That totals, by the way, and then if you look down on the same sheet, under the federal funds, if you could just explain, we're going from FY21 federal level of in the Division of Public Welfare from 170 million to 41 million. That's a 129 million decrease. If you could explain that, please.
Sure. May I, Vice Speaker, Senator Shanazio would be at this time, we'd like to request for Tess to, she's with us and she can provide a response.
All right, before Tess testify, Sergeant Arm, would you please swear in Miss Tess? Please rise.
Can you raise your right hand? Under penalty of perjury, do you affirm that all information that you provide today, whether it be verbally, electronically, or in writing, be the truth, the whole truth, and nothing but the truth, so help you God? Mr. Chair, under oath, you may proceed.
Thank you. Art, maybe you defer the question to Tess. Are you aware of the question, Ms. Archangel?
The speaker's
Okay.
questions with regards
If
to
we
the
could
reduction.
provide Ms. Archangel, please, with the OFB's papers.
Good morning, Senators. Basically, the Medicaid funding is lower than what is expected. The reason being is because there's no proposal or HR that is on the table right now with regards to the Medicaid funding. The Medicaid funding received in fiscal year 2021 is 129 million. But that's based on Public Law 11694. So pre-public law, we have to go back to Section 1108. So the total amount that we're going to receive, if there's no proposal or there's no bill or there's no additional funding that will be given to Medicaid, then that will go back to 19 to 20 million. So if you're going to calculate 19 to 20 million, that's a big difference. So the local match of that is only 45%. Yeah, so
Okay.
that's the reason for the drastic decrease.
All right, but it's even drastically decreased from FY20.
Yes.
Okay.
Yes.
All right then, so this is reflecting Medicaid, and hopefully, according to the congressman, he's pretty confident we're going to get that continued or permanent, so I hope that's correct. But you're not sure.
Hopefully, but what's on the table right now is HR. The HR that's on the table right now is just to remove the cap. The federal medical assistance percentage is not in there.
Okay, all right, thank you. Okay, so are you able to confirm what the governor's requested level was from the general fund? Is it like 36 million like you're asking for, 17 million less?
Yes, Speaker, Tess. Yes, Speaker, yes, the amount that we have been allotted for or assigned for 2022 is the 36 million there that we have requested. And that is as you noted, the 17 million, and that's where you're right, we don't have yet confirmation of the ARP funding for public health, but that is what we are requesting for consideration, and we have submitted that to the staff at the governor's office.
I just can't understand how that, we're budgeting that way.
Yeah.
Yeah, that's not a budget, that's not, I don't know, you're asking for less than it seems like you need. Do you need it or do you not?
No, we need it. We need the 17 million. If we were given the 17 million that we're asking under ARP, we would not be making a request for ARP funding. Yeah, we're asking to cover the services for the various divisions as Tommy presented, and one of the key areas there is about, I believe, 7 million is our services to the elderly. That would fund their contracts for 12 months, and not the current approach of amendments after amendments as we identify funds within the department. So if we got that 17 million additional and not touch the, or not.
Well, you're not asking for it, that's the issue, I guess. That's my
Yeah.
issue, is that you're not asking for it.
Right.
And so I can't understand how we're going to bank on something else versus, this is your budget request. But I'm going to move on from that,
Thank you.
Mr. Chair.
All right.
And if you could go to the next page, if you could just explain again, the enhanced allotment program payments is zeroed out for FY22. It used to be 1,149,000, if you could just explain that.
So that now is part of the Medicaid funding for 22.
Okay.
So it's been collapsed into, it's now zero under EAP, but that's been collapsed into the MAP program, the Medicaid program.
Oh, okay. And Tessa, does this budget as proposed,
Based on CMS conference call that we have, the EAP in FY 2021 was included in the 129 million. So we're expecting they're also going to include that. That's part of Section 1108. We asked if it will be a different, if they're going to issue another grant. They don't know if they're going to issue a separate grant for EAP. But then again, based on the budget ceiling, we all put it into the 90 to 20 million of the Medicaid funding.
all right, and are you satisfied then with this budget request for Medicaid? Given that we're now covering additional people under the Medicaid?
Well, definitely not. I will say it honestly. Our expenditure last year is 160 million, total computable. So just based on that, you can see that it will not be enough.
Okay. So according to the budget allocation that we've been provided by OFB, there are additional areas where there are decreases, and in the interest of time, I guess I'm going to just point those out. I guess we should get an explanation on each of those decreases, right? And whether that's really sustainable. For example, the Guam Board of Examiners, oh no, not that one. The, well, it's Medicaid, so I'm gonna leave that to Tess. But the, it says medicines and vacant positions from the HFF is also zeroed out. From 535,000, $500,000.
We were able to offset that cost from the request, the HFF request, by I guess placing the individuals that were being employed through this medicines and vacant positions. They were all moved to either our program income account at the centers, because they were really for the centers, and then also the HRSA Pacific Basin grant award, grant program. So we're able to offset this cost and move those individuals to those two programs. And that's what provided for us to be able
So
to.
the services are still being provided, but just accounted for in another program?
Yes.
Okay. If I could just talk briefly about your PowerPoint on the employees. Okay, so you said about 19%, or yeah, what did you say? 19% of public health's workforce is eligible for retirement, 98 employees. What is your plan?
Speaker, Tess. Test. Speaker, at this time we are actively recruiting. We actually have some positions already that are announced. For example, some key positions that we've announced recently that just got announced this week is the Chief Public Health Officer. If you looked at our presentation, or as you saw our presentation, we have a lot of acting CPHO, acting Senior Citizens Administrator. And those two positions have just this week been announced. We've also announced the position at the Bureau of Nutrition Services again. We're again re-announcing the CEO for the Community Health Center. We've also again announced the position at BOSA, Bureau of Social Services Administration, where CPS is at and foster care. So these positions are constantly being announced. And so we also are currently receiving letters of intent and actual documentation of our employees who have the years of service who are retiring. So as they're retiring, what we're doing is we are moving forward with recruitment. As an example, we worked it through with Department of Administration, and we're finding there are other mechanisms that can be a little more expedient. So for example, Dr. Kaneshiro, this is very clear because she retired on April 23rd. Her position now in May this week is already announced. So we are really trying our best. I've also worked with the hospital administrator I have on loan right now, Tony Uggan. He's the HR administrator at GMHA, and he's helping me build up my HR office. We're trying to go as automated as possible. We're working on putting staff in there. We've got a few, but it's a tough beginning. It's kind of rough right now, but we look forward to it smoothing over in the coming months, where we will have a more automated system for HR activity within public health. And we are reaching out to both DOA and BVMR for assistance to move forward with our recruitment. I've also talked with the Chief of Staff about some of the needs we have for the department and the need to move forward with recruitment, and I'm getting their support as well.
Yes, so in your testimony, you said you are currently recruiting 35 additional staff for the Division of Public Welfare. 35 additional staff, is that to replace these, or that's on top of your current staffing levels?
Is that, sorry?
That's from your
That's going
testimony.
to replace?
And then you also said the request for increase in the Division of General Administration is to hire, human resource people, safety officers,
Correct.
equal employment officers, grants management office.
Right, yeah, that is correct. We are asking.
Those are all on top of your current staffing patterns.
Correct. The safety officer and the EO are not within the department's budget at this time, and the size of our department, and how much work we do and the kind of work we do. We should have a safety officer and we should have an EO in place. They were actually in place some years ago.
Okay.
They were zero funded. A lot of it really is a fiscal constraint, Speaker.
All right, so are you able to fund those with the 17 million less that you're asking for?
That's part of that approach, ma'am, is 17 ARP funding would help us fund for those positions.
So the answer is no. You're not able to fund. Are you able to fund your current employees with the 17 million less?
Current employees? Yes, with the current, yes. We will fund.
Are you able to fund the additional 35 that you're recruiting?
The 35, that's for, according to tests, those are for replacements, so we would be able to fund it.
Replacements? Those are replacements.
Well, currently, we have 57 vacancies.
57?
Division of Public Welfare has 57 vacancies.
Are those funded? I mean, are those funded? Or will those be
Some of
funded
them-
with
some
the
of-
$17 million general fund request, less? And are those covered? Are we going to be able to fill those vacancies?
The 35? No, not according to tests, no.
Not 57. As you can see, what was requested only is 35 vacancies. That's total for the entire public health.
So of the 57, we're looking to fund the 35, ma'am.
Okay, and then, I guess I'd like to see that for the rest of the department. What are you not going to be able to fund with this request that you're making? And why did you decide not to fund those or to request funding for those? And I am worried about, as the chair said, the institutional knowledge that's going to be lost at public health, and I think, you really need to have a plan in place. Could you just point on your PowerPoint on the personnel, where it talks about personnel breakdown? Some of these are unclassified employees. Could you just explain why the Division of Public Health has 139 unclassified employees?
Absolutely, yes, I'm sorry, I keep going. I'm so sorry. Speaker, The large number in the Division of Public Health is because of the types of grants that we have. They're limited term employees
Okay.
or temporary appointees. And these are because these are COVID-related grants. So we're not putting these employees on a permanent classified status. They're being hired in very specific purpose and response. So we have like the expanded laboratory capacity grant. We have the vaccine. Sorry.
Are you saying that the 139 unclassified employees were all hired because of COVID?
Many of them were. I don't have the exact number how many were related to COVID, but a good majority are. We've hired nurses, program coordinators, CDC.
All right, if you could just give us more exact, I want to know
Sure.
if this is something that you're going to continue with then? Will these employees stay on or are they temporary?
If they are limited term based on COVID, they would be temporary, ma'am.
Okay, and then.
But we can get you the numbers of those that are pandemic specific and those that we are looking in terms of those positions that will phase out as the funds phase out.
All right. Is, in your request for the Division of Environmental Health, talk to me about, this is the one division I thought should be increased. I know it's all federal, it's all special funds
Yes,
right now.
yes, it is. Yeah.
But are you going to be able to increase staff in that division with this request?
I know that this is just very tentative, but we are banking on the ARP funds to expand the capacity of the division.
ARP funds?
Yeah, the American Rescue Plan.
So you're not able to,
Not with the current level of funding that's assigned to the department. The
All right.
current level of funding restricts our ability to increase. If we were to increase environmental health, it would severely impact another division or the other divisions.
well,
So
yes, I'm going to really help get a detailed, of the 17 million versus last year, 17 million less versus last year, what's being cut? Yeah, what exactly are we not funding there? And I can see it in the charts, but yeah, I want to know what services. Okay, and then, so for the same question I have is for CPS, BOSA. Are you funding with this current budget request all the vacancies at CPS?
in terms of CPS, and
Or
also,
the potential, are we maximizing our potential over at CPS, or are you limiting them?
no, I'm not limiting them, but I'll have also the deputy, I can speak to it, but we are funding an additional local fund for the Division of Public Welfare specific to CPS or BOSA. And let me just pull that up here. It's 100 and, you have that?
Tess?
It's 100 and, what is it, 114? 114?
As you know, BOSA is block grant. So basically, their 2.9 to 3 million funding for salary is its cap. But then again, just recently, just this month, we received 816. Just last week, we received an 816 that we can utilize to fund the vacancies that we need.
And
Yeah.
is that?
But then again, you know, next fiscal year, after fiscal year
Right.
2022, we need a sustainable funding for BOSA. It's always been an issue with BOSA because the funding is received always after the fiscal year. So we haven't received fiscal year 2021 funding. It will be received after September. So there will be some funding there.
So, Speaker, we're also putting funds aside of $114.68 to support the CPS office, which is BOSA. I don't know, Terry, Deputy, you have anything else to add to the discussion with regards to recruitment? With regards to recruitment efforts?
Yeah. Buenas and half a day. I'm Terry Uggan, Deputy Director, Department of Public Health, and thank you for having us here today. Child Protective Services has actually gone through quite a bit over the last few months, and part of that is identifying the vacant positions within Child Protective Services that are critical to the mission. We do have currently 12 vacancies that are actually funded positions that we are trying to recruit for. But at the same time, Child Protective Services has received on average 1,300 referrals a year for the last 5 years. And because of the mandates, the law, saying that cases have to be investigated within 72 hours, or at least initiated within 72 hours, it's very challenging given the numbers of staff that we currently have. So we are very active in trying to recruit for the positions, but even that recruitment process definitely has its challenges. And in addition to that, the nature of the work that Child Protective Services requires, addressing the sexual assault of children, the physical abuse, the homelessness, often very substance abusing parents. It isn't one of the areas or one of the bureaus that really tends to attract your average social workers. It takes a very special person, individual to really palate that kind of daily operation. And because it does function on a 24/7 day a week, and because it continuously has crises, currently we do have over 450 children that are in foster care, which includes, of course, our group homes, our licensed foster homes, relative placements, but it also includes children that are in unlicensed homes as well. So the onboarding, the training of staff is critical, as well as making sure that we fill our vacant positions. Thank you.
Okay, so if you could tell me, Deputy Director, aside from the difficulty in recruiting and filling these positions, does this budget reflect adequately address your needs? Does it give you enough money to fill those positions? And does it give you enough money for what you're describing as the needs of?
So our current budget, of course, as Tess mentioned, the good fortune of being able to be more flexible will help us recruit the 12 positions. But even with the 12 positions under the American Rescue Act, we are requesting for additional positions to make sure that we can uphold the mandates of the law.
Yeah, and so is that reflected here? Not, right?
Yes, it
Director?
is. Yeah.
Are those additional positions that are needed reflected in this budget request?
In the current 36 and 16, no, ma'am. That's also part of the American Rescue Plan Act request to the governor's office to be funded to augment the current boss's staff. But as the deputy director has also presented, yes, it's definitely, even with environmental health, we want to hire more. One of the discussions I just had recently with their leadership in the environmental health is, do we have the manpower resource available that will compete for those jobs? So yes, we're asking in the American Rescue Plan over $2 million for environmental health, but we also need to be sure that there's applicants. So for example, the former administrator for BOSA, that position, again, is still being announced. We've had a scheduled interview. All applicants declined the interview. And as the deputy is expressing, there really is perhaps a concern in terms of professional environment, the work environment that you're coming into. You could be a BOSA administrator and work with CPS, Child Protective Services, 24/7, foster care, but then you could also take a similar paying position elsewhere and not deal with that type of environment. So, it really is a very challenging but yet rewarding area to work in the department to protect our children, of course, and reunification of families. But no, it's not part of the 36. There is a supplemental, what I'm calling a supplemental at this point, with regards to ARP funding, American Rescue Plan.
All right, well, I'm concerned about that because while I support public health, getting access to the ARP funds, I just feel like you can't bank on something. This is your budget hearing, and I would like to see you advocate for what you actually need, so we don't have to go through that with the children in the upcoming year and keep saying we don't have enough. And if we're having a difficulty in recruitment, then I would like to see a plan to how are we going to call these difficult to recruit positions, right? And let's make some adjustments or whatever it is that is needed. So I know this is getting long, so I'm going to pass, but I have two more very quick questions. In the CARES Act slide, it says COVID-19 grant awards. Is this separate from the $117 million that the governor received?
Yes,
All right.
Yes, this would be separate.
Okay, and then on the ARP funds that you are requesting, we were told, I think even by the governor, that you were going to be getting your own separate funds. I don't know if ARP funds or just a separate title on those
Well,
coming from these relief funds that Congress is passing.
right. So some of the programs are receiving funds, and they're good from now till FY22. But some of these funds will be used for FY21 shortfalls, and anything that's not used will be also carried into FY22 to be used in the upcoming fiscal
Okay,
year.
but those are not reflected here. Can
Well,
we-
there's actually one there that I recall. It's the one for the Division of Senior Citizens. That is.
that was what you received, right?
Yes, and we can use it currently for 21, and we can also use what we don't use in 21 into fiscal year 22.
Okay. Is there any other funds that you are anticipating receiving?
That's what we're getting from the divisions right now, is presented by Tommy. That's what we have at this time. I'm not sure if Tess has any other ARP funds. Yeah. So we're getting them little, like for example, we're getting supplemental funding, but not necessarily ARP. So we're getting like supplemental funding for the immunization program, the vaccine program.
Yeah, so if we could see that, if you could just give us a breakdown of those. What's
Actually, yeah.
different then from FY21, right?
Okay.
If you're receiving anything in addition? Yeah, okay, thanks.
Yeah. So we can give you the difference between 20 and 21, ma'am.
All right. Okay, Mr. Chair, I know it's getting long. I'll pass if you'll allow me to come back in the end if there's anything else. Thank you.
Yes, thank you, Speaker. Art, I just want to make a very clear statement that I agree with the Speaker that we're going to be monitoring the ARP distribution, yes. But we're going to actually monitor and have the budget analyst from the OLB actually eye that the 17 million that you really need today, even though you're banking on ARP, we're going to consider that because the budget's not complete. We're not done. There's many other agencies to consider.
Sure.
But we're going to be monitoring that with the Speaker and her committee and watching what's going on at Public Health. Like we'll watch everybody else. But more specifically to when it relates to ARP, if the money is freed up by the governor, then of course we'll reduce it from your budget. If it's not, then we have to seriously figure out a way how to get you funds. We want to make sure that the people of Guam are protected and you fulfill your mission statement, you know? Exactly what you stated here. To assist the people of Guam in achieving and maintaining their highest levels of independence and self-sufficient in health and social welfare. We've got to make sure that that's fulfilled. That being said, I'd ask the Vice Speaker, and you'll be followed by Senator Torres, and then we'll move in the order of my colleagues that have attended. Madam Vice?
Sidus Masi, Mr. Chairman, Ana Sidus, and to the panel members, thank you so much for being here and the team that's out there in the foyer. First of all, I want to begin by extending my true appreciation to the staff and the leadership of the Department of Public Health and Social Service. We have been under a public health emergency for over a year now, and no one can deny how essential your agency is and the services you bring to our people of Guam. So if we've learned anything during this pandemic, it is we need to effectively invest in public health, and because of your mission to provide for the island at large, the Department of Public Health and Social Services has to truly provide a broad range of services from vaccinations, medical assessments, prenatal health checks, to restaurant inspections, protection against infectious diseases. These services, among many, many others, keep our society and our economy going. So I want to say that part of our success in controlling the spread of COVID-19 has been the hard work and dedication of our public health nurses, our frontliners. That is why I want to continue to say that I co-sponsored Bill 61-36 with Senators Mary Torres and Secretary Amanda Shelton to increase the pay of Gov Guam nurses by 15% until we complete that wage study that was designated by Public Law 35-125. So my question is, how can we support you in your efforts to recruit and retain public health nurses? Anybody on the panel can help me with that?
Well, Vice Speaker, yes, thank you. How you can help us with that really is, as we are though face the challenge of fiscal constraints, if this great body, the body here, could help us identify funding to meet the nursing requirements in terms of pay, that would be very much welcome. We are in full support of the pay adjustment. We just need to be able to afford that pay adjustment. And that pay adjustment is not included in our 17 million plus requests with American Rescue Plan for the nurses' pay adjustment. What is then the American Rescue Plan is really the potential loss of revenue, like for the health center, who experienced over 700,000. But anything that you could do, and the rest of the senators and the speaker as well, to assist public health and social services, to be provided additional funding to meet that increase in the cost of having our nurses on board. Also, if for consideration, ma'am, and we also discussed this with regard to when we came before this body to discuss the medical complex and how public health is one of the 3 agencies looked at for construction of a new facility. We are also very open if there is a means or a way for GMHA to be assigned to hire our nurses. In speaking with the current HR administrator from GMHA, Mr. Egg and I discussed that the onboarding of nurses at GMH can be in a day, can be one day. And I'm very impressed with that. So I was asking him, what is the possibility? I mentioned it to Lillian Posadas as well, that I'm excited about that, because if we can onboard a nurse in a day at GMH, if they meet all the timelines, or even in 2 days, it takes much longer at Public Health and Social Services to onboard a nurse. And so they have a system in place. And so if there's some means, speaker, vice speaker, for us to access just at least for nurses, that would be a welcome reprieve for Public Health and Social Services. And as nurses apply, we send them and route them in collaboration and partnership with GMHA, and that would help us in terms of recruitment. And I think that would also help, because sometimes as we're trying to recruit a nurse, we're competing with other entities like GMH. And so if we're able to get that done sooner than later, perhaps we'll be able to get more nurses on our site.
Thank you. Thank you, Art, for that. In addition to nurses, social workers have been working at the front lines this entire pandemic, and the declaration of the state of emergency within the Child Protective Services Division of Public Health proves that more needs to be done to protect our island's most vulnerable. What, if any, plans are there to strengthen the division, and what kind of support is needed to recruit and retain the social workers in public health? And I know we're struggling there, so if you can share some insights. Anybody again on the panel?
Deputy, would you like to? Deputy Egg would like to take that. Thank you.
Thanks, Terry.
Right. Thank you, Vice, for that question. Right now, as I mentioned, we have 12 vacancies that we are reaching out to fill. But to strengthen Child Protective Services, to get it to where it needs to be today, is to make sure that we onboard additional staff. And we are looking at additional 24 staff, 4 social worker 3s, 15 social worker 2s. We are looking at a social services supervisor, as well as a social services supervisor 2. And the social services supervisor 2 actually was a previous position that Child Protective Services had, but through the years, the position was done away with. Its role, its purpose, is to make sure that they monitor the flow of referrals coming into the system, make sure that they are moving amongst the different units to include crisis intake, investigation, case management, and so forth. All of these units are critical to the outcomes, positive outcomes for children. And so it is a matter of onboarding 24 positions. And again, social worker 3s, social worker 2s, social services supervisor 2 position to oversee the supervisors that are there.
Madam Vice Speaker, sorry.
Yes, go ahead, Art.
Madam Vice Speaker, if I may also add, I echo everything our deputy has said, but also would like to ask for your consideration and that of the body. Perhaps at this time, given the critical role that we all recognize the role of a social worker has in the life of children, adults, persons with disabilities, perhaps we can look at how we can incentivize their pay as well. Because they do work long hours. They, I mean, we got to do something to compensate them. They're dedicated at CPS, and they know they come to work, sure. But if there's something that they bring home a little extra to the family, their spouse knows, okay, my spouse is working these long hours, they're protecting the children of Guam, but the department recognizes that significant contribution they're making, and they're compensating them for that extra work, for that time and dedication. Perhaps it's time to look at all the social work positions throughout Guam and look at what they're getting paid. And it's time that we elevate them because they are critical for the care, the coordination of care for our victims, for people trying to restabilize themselves, to stabilize their home and their home environment, their family. That's sometimes the first person someone calls and cry for help. They're looking for a social worker. So if we could consider that, Speaker, Vice Speaker, members of the 36, Senator Joe and the committee chair of this hearing, that would be something that we would welcome. And yes, we would ask also for support to fund that adjustment should that go through. Thank you.
Thank you. As Oversight Chair of Human Resources also, and the need for the 24 positions, doesn't hurt to work. We can work closely together to see how we can facilitate those GG1s moving forward, and the need for that, because you've also stated that there's, the need at looking at the 19% of vacancies that will happen, and then the need. I know there's continuous. There's a continuous application for these positions. How can we further bring it out to the community to see how we can get people in? So don't hesitate to check with me on that. Also, maybe a reiteration on what you said earlier, based on the speaker's comments regarding the addressing your workforce that is anticipating to retire. If you have that plan in place that you can address with us to see how we can fulfill those critical institutional knowledge, the positions that, those have been here for decades.
Right.
How do you plan to proceed that? And then also, what efforts do you have to fill these positions? Again, maybe that further reiteration from what was stated earlier, just so that I can write it down again, or write it down, I missed it.
Noted, Madam Vice Speaker. We could do that. We could look at all those that are going to retire and see where they fit within public health, what positions they have, and what we would be doing to fill those vacant positions. And yes, some of them will be leaving with institutional knowledge, absolutely, that we would value, and we would need to train up the current staff.
Okay, I will continue to work closely. Terry, you have any thoughts on?
If I may, I'd like to not only say that part of it is making sure that we have new blood. We've got eager and interested young folks to sort of move and take our places as people start to age out and retire. But I will say this, we will continue to have an incredible turnover among social workers, especially in the area of child protective services, if we don't take a stronger stand around our onboarding, our training, and making sure that these people are well prepared to take on the challenges of extreme sexual assault, maltreatment, physical abuse, the substance abuse areas. We have had our time where social workers literally break down and cry during meetings because they've been intimidated, they've been threatened, they've been sped on, they've been followed in traffic. I mean, the list goes on. It takes, again, a very special type of worker to work at Child Protective Services. And if we're going to maintain the energy and stay on target with the mandates of the law, we need to beef up our training as well. So I really appreciate the support. Thank you.
Thank you, Deputy Director. I promise, Mr. Chair, one last question. The loss of the Central Public Health Facility has literally forced the agency to find rental properties to accommodate the divisions that have been displaced. How much is DPHSS paying in rental fees, and can you break it down by rental properties and amounts? Do you want to answer that, Terry? No. Anybody?
For For the Division of Public Welfare, we're roughly paying 1 million a
Okay.
year total.
And the rest?
Sorry?
Art,
Madam
do you have
Vice-
the answer to that?
Yes, we do.
Okay,
For
thank you.
rental, this is combining annually for federal and local funds spent. It's $2,073,192. Federal dollars at $1,068,620.40. Local funds at $571.60.
So for a grand total of?
$2,073,192. This includes both federal and local funds being used for public health office lease, public health and social services office lease as of May 12, 2021.
Thank you very much. Based on that, I just wanted to make sure that based on the facilities and you having to be forced to, losing your Manila facility and trying to adapt to what was out there, is where can we find the home where we can have everybody come back at least into the central areas, and making sure that we can ascertain the support coming from the south, because I know that the properties down there are not being utilized to its fullest, and not for any fault of your own. I was told, is the southern facility being utilized yet? Yes, Terry. Sorry, Mr. Chair, I promised last one.
Yes, it is. It's not used to its full capacity. However, there are a number of services that are available at the Southern Regional Community Health Center. And of course, that includes welfare programs. So MIP Medicaid, people can apply for services down there as well. Clearly, we need to make sure that we beef up our WIC program. We beef up our primary care services down there. I think the clinic very much stands ready. I know the air conditioning was working well last time we were there. I think it is also wanting to redirect and make sure that we have a lot of the resources. I would like to add, if you don't mind, that with the closure of the Manila Public Health, it's not only a matter of urgency that the department find housing for displaced programs, especially around our non-communicable diseases, which of course the island is plagued with, but the fact that what that means to the community of Guam. It's a central location. People could go there for multiple services. It in itself was a one-stop area. And with the closure of that building, you find people either walking the streets or catching public transit just to access services that are at multiple buildings right now. So there is that level of urgency, and I do appreciate it being brought up today. Thank you.
Thank you, Terry. Thank you, Mr. Chair.
Thank you, Madam Vice. Senator Torres, do you have any questions, ma'am?
Yes, thank you, Mr. Chairman. Mr. Agustin, Mr. Uggan, Mr. Taitagui, Laurie Duenas, who's out in the hall, and Ms. Archangel Suzus Masi for your presentation today. I believe that many of the variances in your budget proposal you laid out very clearly in your presentation this morning, and I appreciate that a copy was also provided to us. I just wanted to note that in looking at your overall budget proposal, which you pegged at $98,055,007, that the actual your actual budget proposal versus your proposed expenditures has that variance of $17,883,560, which you were going to request of CARES. So I just wanted to comment that I believe that your exercise in requesting that $17,883,560 is pretty much what this body had hoped many of the agencies would do, to look at how they can use the federal aid money from the American Rescue Plan Act to help where applicable, decrease the operating budget request, as I understand. And I know that in agencies that appeared before us, before you, they were lauded for utilizing as much of the federal money to offset what would otherwise be a government expense. So I acknowledge that that appears to be what you were trying to do here, leverage where you could apply some of that federal American Rescue Plan Act money and augment. Because in true, your budget, your expected proposed expenditure is actually not 98 million, but is actually 115, almost 116 million, correct?
Correct. Yes,
Okay.
ma'am.
So thank you very much for going through that exercise, because I think in our challenging economic times, that is exactly what we had hoped agencies would do. And you did that also, notwithstanding the 129 million in grant aid that you also got directly for COVID-related expenses, right, that are non-recurring expenses. I just wanted to touch upon a couple things, follow up with a couple matters. I think, Mr. Uggan, you were speaking about the increases in Child Protective Services needs. Your presentation, Mr. St. Agustin, also includes the increases in the Title III home and community-based services needs. The clientele has gone up in the elderly, looking for assistance, registered clients by 28.5%, and then the number of clients that are actually looking for assistance in their daily living is up by 21.32%.
Right.
The meals are up by 50%, and the case management systems by 46%. Mr. Uggan, you talked about the need for more people to help service, that they're short on staff. Is the problem on Guam a problem with the social worker pool, that there aren't enough social worker graduates or people available in that profession?
Thank you, Senator, for that question. You know, I think when we look at the overall picture of Guam, we're finding that our baby boomers are aging out. And clearly, many of them suffer from conditions such as high blood pressure, diabetes, and so forth. And we have such a history of that here on this island. So we find that people are becoming disabled or they quit work a lot earlier. To be able to have that infusion of workers, of staff, to be able to address the growing numbers of baby boomers that are aging out with disabilities is very key. So yes, indeed, part of that is just the population and how our population is aging.
So the demand is put the greater demand is put a strain on the ability to service, right? That's the disproportionate.
I would say yes,
Okay.
but I would say too that we have the good fortune of people like Dr. Lisa Natividad at the University of Guam with the School of Social Work, who's assuring us that there are a number of new graduates that are coming out. Wonderful group. We just want to make sure that they have a level of that institutional knowledge, which I know comes with time, but at least the onboarding, the practicum, the training, and making sure that we can elevate them as well to take on these challenges.
Okay. Have these social workers been, have they been able to avail of hazardous pay during the COVID pandemic?
You know, the staff, social workers at Child Protective Services actually is a bubble. And so we really haven't activated the staff to take them away from their jobs. We do have, of the 35 or so staff that are there, 2 of them actually respond to the COVID pandemic. But it is, for one, after hours at the airport, and therefore it doesn't interrupt his daily job. And then the other one still comes in and works on requisitions and so forth, and he is with logistics. So it's a very minimum amount of involvement, not any of them to take away from their duties at Child Protective Services.
So your suggestion about some incentivizing through pay adjustments, then I see how that, because I was hoping that it could factor into the hazardous pay, but I see how their functions are stationary. They haven't actually been a direct part of the COVID response per se that qualifies them, right?
Yes, yeah,
Okay.
it is indeed a bubble, and the staff at CPS have not been required to, unlike the rest of the Department of Public Health that take a very strong fold, CPS is excluded from that, so they can function on the referrals that are coming in. But I do agree, there needs to be an incentive. People need to be valued for the hard work and dedication that they invest in their jobs and our children and families. And clearly, part of that incentive is to give them an atmosphere that's safe, to let them know the department stands with them, not just behind them, to make sure that they're onboarded properly with training, and to make sure that they're valued with their commitment, and often that's in the form of a financial commitment.
Okay. Mr. San Agustin, one of the effectiveness of people to access and to go into the community is the required tools in addition to the personnel. Is public health in need of additional vehicles so that people can adequately access and service these homebound patients or conduct these home investigations?
Just so clear, Senator Torres, the question is, do public health need vehicles?
Yes, is the ability to conduct home services or investigations hampered in part by the lack of vehicles and other tools by public health to be used by these social workers?
Yes, absolutely. Vehicles, it would be a plus for our field workers. For social workers, not just at CPS and BOSA, but throughout the department as well. Some sections are challenged with, we all get different levels of funding. Some programs have funding that they're able to acquire a vehicle for their program and do the work that they go out for investigations or outreach as social workers, and some don't have that kind of funding. So yes, that would be a plus for them to be able to have that as an added tool to the work that they would be doing.
Could that be a CARES Act expenditure?
We probably might look at the American Rescue, if that's what we're looking at, American Rescue Plan. So sometimes, like in anything, we have a fixed amount of money for a program, and then we have so many warm bodies, and so as we get the grant award, the first thing we do is we ensure that the warm bodies are covered through the grant award, and then we look at what the next obligation we would have to meet, be it rental, utilities, Xerox lease, for example, a photocopier lease, and then every so often we're able to identify additional funds, or we do a lease agreement so that we can afford a acquisition of a vehicle. So yes, we would need, but if it's within the department, we'd have to reassess our priorities. But if it's through CARES Act funding external to the department, then yes. For example, with vaccines and immunization, they may be able to acquire a vehicle, but it would be focused on accessing vaccine clinics or bringing people in to be vaccinated. So that would be something that a program may be able to be approved for, but it would be focused on the purpose of the grant.
Yeah, I just bring that up because if you consider all the most vulnerable that have been severely impacted as a result of COVID, that required direct services, home services, you know, it just seems logical that it all plays in because one triggers that kind of a reaction or a growth in the number of clients. And so, you know, I just brought that up because I think as we're looking at the additional monies that we expect, you know, as you've done in your budget, you know, by identifying even 17 million that would be applicable, perhaps there are other areas that would augment your agency. And
Senator, if I may, you're actually on a key note. As we talk about public health and social services, one of the key concerns we always have is access. And so even with the vaccine administration, a key concern we've always had is access. Some of our residents don't have access to a vehicle, don't have a vehicle. So that has been one of our efforts, like in the vaccine administration and even in testing, is bringing the service out to the community because of not having that vehicle. So if we were equipped with our staff were equipped with a vehicle, that would also augment our effort, would add on to our effort to reach out from a social work perspective as well. Thank you.
okay, I just wanted to end by saying Sizus Masi to everyone at Public Health. Many of us have not forgotten, notwithstanding the COVID fatigue we're all undergoing right now in the opening up of our community and our economy again. Many of us have not forgotten the significance and the important role that each one of you has played in the COVID response. And we started off this COVID adventure or this journey lauding you as heroes, each one of you and your personnel. And I just want to reemphasize that that sentiment has not grown old and that we still appreciate and continue to pray and offer our support for public health and all that you do for the community, especially our most vulnerable. So I just want to say that I still hold that sentiment about the significance of public health and all your personnel to our island community. Jesus Masi.
Thank you very much, Senator. We appreciate that. Thank you.
Thank you, Senator Torres. Senator Brown, do you have any questions, ma'am?
Thank you very much, Mr. Chairman. I mean, not so much questions. I certainly appreciate the presentation that's been provided by Mr. San Agustin and his staff here at Public Health. Certainly, I know a lot of time and effort has been put in by you and your staff to come up with your budget, so I certainly appreciate that. I concur, actually, with Senator Mary Torres' view with the ARP funding. I think whatever steps we can take to maximize that. I mean, I know we're still awaiting the governor to provide us a formal plan. We've not seen it yet on how she's looking at distributing these funds, but I'm sure there's no doubt collectively we can agree that public health and the services that are provided by public health to our community is one of those things at the top of the list. So certainly the efforts that you are putting in place to maximize the use of this funding this particular year, and as you mentioned, if it's not used this year, can be used into next year, certainly is very beneficial. I've said this before, I'm going to say it again. We're living at a time of a very artificial economy. And fortunately for us, it's one of those moments we have to say thank you to the federal government for providing this funding, because the alternative of where we would be, I think, would be quite dire right now. And I don't think that reality is going to totally disappear. I think in the next year or two, certainly if the U.S. economy continues to pick up and the COVID cases go down, which is the hope, more than likely we're not going to continue to see additional funding of this amount. No leadership in the history of Guam has ever received this amount of money, so I think we recognize that. I just want to ask, as you're looking into, of course, maximizing the use of these funds and the critical needs that you have, are you looking at how you're going to balance that out in the next year or two if there are additional personnel, as you mentioned, that are needed? And there's no doubt there's always going to be additional personnel that are needed within your department. Are you able to balance out anticipating, let's say a year or two from now, we're back to a regular GovGuam budget, maybe a GovGuam budget that might be in decline as a result of our challenge to bridge over before our tourism industry hopefully is back in operation, back in place, and the revenues are coming in? I think we understand that that's not going to happen overnight. So while we're doing fine this year, perhaps better than we've ever done, the next year or two, I think, are going to be very critical. So are you looking at that as you look at filling critical positions to be able to have a budget, even if it's status quo from where you are now with local funding, to be able to sustain and maintain those positions?
Senator Brown, thank you for your comments. And yes, we are looking at that. As a matter of fact, earlier in my initial presentation, we are building up the capacity of the department on the HR site. That will let us know what positions are there, not there, vacant, funded, and what are critical, based on input also from the division heads. We're also building our fiscal office. Right now, we have Tommy primarily in the fiscal office, my ASO, and 2 additional staff. So we're going to be realigning our fiscal team to move into the business office, and that's going to happen very shortly. We also now have a grants management office that we're standing up, and they're going to do periodic review of all existing grants within public health. So just in this exercise, as we are preparing for the budget, it's not a large amount, but we charge for, at the director's office, we pay for the full use of internet access, the platform, as well as the email address. But many of our grants currently today can actually absorb that. So if a program has 10 employees, we would assign the charge for those user fees to that program for 10 employees. So yes, it's really bringing us to the table to say, this is what we have. We're going to be phasing out these individuals that are on COVID funding, but then what are we going to do post-COVID? How are we going to look? Because that's a conversation in putting these offices together and putting these systems in place would help us. And it would, what I'm hoping is by setting this up, the public health, the new directors, new administrators within the Bureau will appreciate this, and that would be a long-standing way to do business in public health. We have a robust recruitment team, we have a robust fiscal team, and we have an internal grants management review team so that we can make sure that we deliver as per the grant, but we also account for funding. As an example, if a grant receives $400,000 and the plan is to spend $100,000 per quarter, this grants team will be bringing that program in and talk with them. What are the challenges? Let's not wait till August 31st or September 30th at the end of the fiscal year where they're saying, Mr. Director, you need to sign this because this is due. Or we're going to lose $300,000 because a requisition PO was not issued. We should be doing that months ahead. And so we're trying to build that up, but it is, with COVID-19 and just the daily operations, it has been very busy, but we're definitely up to it, and we're going to continue moving forward, although maybe slowly or slower than I'd like, but we are going to be moving forward, and we are looking at what we're going to look like in the years to come.
Well, I definitely appreciate that perspective because you certainly describe the challenge every department seems to be going through. Rather than being proactive, it's waiting to the last minute and sometimes, unfortunately, missing those grant opportunities. I mean, certainly, Mr. San Agustin, you yourself have worked your way up in the department from 30 plus years ago when we first met to where you are today to know the inner workings. I know Terry as well. I mean, many of your key people that you have are good points of reference. And, we have a tendency to want to think it's our greatness that makes things happen, that thank God made us, because if it wasn't for us, I mean, nothing would move forward. And I appreciate your insight and awareness that I think most of us would like to see is that there's a bigger mission. The mission is bigger than us, and delivering on that mission is bigger than us individually. I mean, sometimes we're too wrapped up in taking the credit that, we don't want to do the real work that's involved. But I appreciate your comments because we definitely need to prepare for what is coming. I mean, I don't want to look at doomsday, but I've done enough GovGuam budgets to recognize that while times right now, great that the money's coming in and we're able to sustain ourselves through these challenges of COVID, but I fear where we're going to be in a year or two if we don't have that continued stream of money coming in. Where are we going to be? And then the challenges that your department is dealing with, particularly with the most vulnerable in our community. I was just reading an article, and these moments just really, they anger me so when I read about parents. This one mother here that, is abusing her toddler in the presence of officials that are there to intercede and intervene because she is being abusive of her children. Or the elderly, as I know, Mr. San Agustin, you're very familiar with in our community. I mean, Guam's a very loving and caring community. You also are up front aware of the realities, particularly among our senior members in our community that have not been, don't have that familial support, even if they live within a home of family, that are not properly taken care of, those that are bedridden, that cannot take care of themselves, that are abused in this community. It's very sad when we see and know that these things are happening, and certainly to the degree that the government, through the work that your people are doing, are able to intercede and support and help them. Is so critical because that's at our most basic level of humanity. It's such a statement to us as a community. We want to talk about all that is good and wonderful and how we contribute to that, and yet, we have the other side that is not so pleasant and not so kind to our very people, our own familia on this island that are not taken care of, especially the children. But nevertheless, I don't want to belabor this because I know I have other colleagues that have comments and questions, but I think this is the reality of the work that you do, and I certainly appreciate the work that you and your staff do to help us in these areas of our community, especially when our economy and things are challenged. I mean, those are the areas that are hit the most. I mean, coming back into office, I had an elderly person call up because they needed assistance to get their medication. They didn't have anyone else to help them. Something as basic as that we can get in our car and go and do. We sometimes forget there's others that don't have that opportunity or don't have that support. So thank you for the work that you do, and I appreciate you being responsible with your budget, trying to maximize what you can out of ARP, and then look at how we can bridge over so that we can hopefully sustain funding those critical positions that you're looking at filling in the near future. With that, thank you very much, Mr. Chairman, for the opportunity to ask questions with regards to the public health budget.
Thank you, Senator Brown. Senator Tello, do you have any questions for the panel?
Thank you, Mr. Chair, and I greatly appreciate how you're allowing us who came in first today. Greatly appreciate that. You'll get a hug from me later. Anyways, Hi, Senator San Agustin. I was going to say Director San Agustin, and to the deputy and everyone here, and Mr. Taitigui, as well as Joannis, who is out. Thank you so much. Terry and Tess Archangel, who I always seek information from. You're very good at providing answers to some of these questions that we have, which I'll bring up later. Senator, I keep calling you Senator. That's San Agustin, but no, sometimes that's selective thinking, or wishing, hey, opportunities. Make sure you run Republican. No, all kidding aside, you're doing a great job at public health, and we'd like to see that continued on. And
Thank you, Senator.
yeah. So just some questions with regards to your prior obligations, other debts. It was in the paper in May 18th, just recently, that there are about 11 agencies that have some old debts, prior obligations. And I noticed that public health was in that article. It said that there was an old debt of $22,449. Is that correct? And have you incorporated it into your budget? I know it's small, but still, it adds up.
With what prior year obligations we have now, we're addressing them currently, and as we have the provision to address them in Public Law 3599, we're on it, and we're trying. We identify funds, and then we address those prior year obligations.
So Tommy, right now it's saying here in the paper, they went through different agencies. It's saying that the only thing that public health has right now for old debt is $22,449. Is that correct? If you don't have that answer, it's okay. You can send it to me later on.
I'd have to just take a look at what we reported, because I believe, if I'm not mistaken, that they were just prior obligations for employees, overtime for past storms. I just need to clarify.
Okay, and if you're trying to look for it, go to the May 18th out of the Post. It has a list of those old debts that need to go in, and it lists public health. So if you can look into that. How much do you pay in rental? How much have you been paying in rental in the last year? Ever since, yeah. And also, Tommy, if you can, how much you paid in the last year for rental, and then the second is any of that rental funding coming from federal funds?
Yes, as mentioned earlier, what we pay annually based on our monthly charges right now is $2,073,192, and of that amount, federal funds provides for $1,068,620.
Okay.
And the remaining $1,004,571, they're from the local part of the budget.
From local funds. Okay. Thank you so much for that. In the Terry, if you can answer this question, I know you're very engaged in the foster care, but I noticed that in this budget, it has $760,450 for the foster care home. I believe in 2020, there was a higher amount that was appropriated to the foster care home for that budget, if I'm not mistaken, about $800,000. And now this year, I'm looking at $764,553. I know that the foster care is going to be having a ribbon cutting tomorrow. The foster care home will be having a ribbon cutting tomorrow, opening its doors. And so that I guess the contract for those who are going to oversee the foster care home, I think it's been awarded already, if I'm not mistaken. Can you give us a little information about that with regards to if this amount is going to cover the contractual amount, and if it incorporates the maintenance of the building as well?
Okay. Thank you, Senator, for that question. And, you know, we're very pleased to be able to announce, of course, and invite all the senators that are here in tomorrow's event. And it will be the ribbon cutting for a shelter that already has 4 names. It originally was the Regalo House, and it's moved on to be Sister Bridget Home, and then it's been called Gumama'asi, as well as Ms. Calvo announces it as Ali Shelter 3. A vendor has been identified, but there still is a level of paperwork that needs to be wrapped up. But the shelter does stand ready. We did a walkthrough yesterday, and the various inspectors have had the opportunity to go through with it. I do know this: the number of children continues to increase as far as placements into foster homes, and many of the homes that we have right now are relative placements. Some of them do not receive any financial support. These are families that have the ability to take care of children and have declined actually that support. Other cases, the courts intervene and mandate that protective services make those payments. And of course, we're more than happy to. They have our children, they're providing quality homes. But my point being is that in some areas, the budget has gone down, but the numbers of children continue to go up. And that also means, too, that the number of licensed, regulated homes go down as well, as many of our military families exit the island. I would imagine that as we get more and more new homes coming on board, of course the children are there, then definitely those numbers will continue to grow up as far as the financial responsibility of the department to pay out. But your question had to do with whether the current shelter that will be launched tomorrow is included in those budgets. Okay?
Yeah, the contract amount
Right.
for the foster care home in Berkat Heights.
Basically, it's dependent on the number of children that we're going to house there. It may or it may not be. But for last fiscal year budget, that's enough to complete the Gumama'asi.
Okay, so the contract amount do you know how much that, because I know you've awarded a nonprofit organization.
Yes, but it's dependent on the number of children that will be
So it
housed.
changes, yeah.
Yes.
Okay, so then we're going to do a trial basis the first year of this
Yes.
home and then kind of determine. And Terry, I know there was a concern with regards to a generator that's needed for that home.
Yes.
And has that been addressed already?
Yes.
Yeah, my understanding is that yes, it has been addressed, monies have been identified,
Yes,
and
the fund-
a generator will be installed up there.
We're utilizing the funding for this fiscal year, so it has been identified.
Okay, that's very good because it's opening tomorrow.
Yes.
And that's the last thing we need is to have no power for that area. Okay, we talked about vacancies and that's what's funded and not. Okay, of the 17 million, Director San Agustin, that you were talking about that you did not incorporate it because you were anticipating the ARP funding for that. And then when you were discussing this with us, you also mentioned that when you created this budget, you were given a cap that you were trying to stay within everyone's means considering the situation that we're in right now. So of that deduction that you had to take to cut of the 17 million, where did you cut that from in the department?
So, Senator, we have here a breakdown in terms of that would support the 17 million request. It's quite involved, but we can definitely go over them. We've got, for example, the positions the speaker had asked about under the director's office, those positions, the safety officer, the EEO, that's part of the 17, including their benefits. We also have, for example, the copier lease in the Division of Public Health. Under the Division of Senior Citizens, we have a series of programs there that are also being impacted. We have the General Operations, the Director's Office. We are wanting to fund an attorney for public health. We have so many contracts, and we are working with the AG's office, who is in support of us hiring an attorney through his office, but placed at public health. So we would have immediate access to an attorney, and that's all part of the 17. general operations, workstations, online certification courses for the marijuana certification, payments for foster care, the Chief Public Health medical marijuana software. And then we also have funding for the BOSA social workers and support for their operations in the amount of $2.2 million. Enforcement staff and support for the Division of Environmental Health. This would be doing the regular work that they already do, which is inspections and enforcement, but also do COVID-19 compliance. And then there was program income loss with the Community Health Center in the amount of $759,810. And that's where our $17,883,560 would be placed. Key part of that, and we have the documents here to support the 17 million plus request. We've got 7 million for aging services. Yeah, as one of it was one of the items. And so we just basically laid out all the different spreadsheets and identified where these funds would be earmarked or placed should we get the 18 million ARP funding.
Art, if you can, provide us that.
Absolutely. We'll provide you a copy of this, sir.
Please.
We'll clean it up and send it to you.
Thank you.
Absolutely.
Thank you so much for that. The other thing I have is, well, I greatly appreciate, doing something like that and pushing for ARP money. I mean, I'm sure all the agencies are going to be knocking on the governor's door. But for me, like the speaker said, I think it's important to ask what you need now so we know exactly. I mean, the list that you have that you're going to provide to us, we're going to look at that. Like, we are the ones that's supposed to be providing funding and appropriate funding for your agency. So we're going to do it, the old-fashioned way and do it that way. But and by all means, you need to continue to push your agency for ARP money. Don't be left behind on that. Be at the front door knocking on that. So I greatly appreciate it. The other one is, Tess, I'm probably going to talk to you later about this to just get a grasp of MIP, Medicaid, and the breakdown. But I think I'll just bypass that and work with you because I know that what you said earlier is that it's not going to be enough. You don't have enough. So my question now is, and I know you look at what's happening in Congress and what we can and cannot do. Can our funding be used to match for MIP? Or I'm sorry, not MIP, match for Medicaid?
Based on my knowledge and based on my communication with CMS, we cannot use federal money to match a federal program.
Okay.
So it has to come from the general fund or HFF.
Okay, thank you. So that ends that. And the last question I have for you, Director San Agustin, is with Gita's recent press release regarding the BPT bond refinancing, when does public health anticipate receiving the $5 million appropriation authorized by Public Law 36-9, and can a portion of the agency's request for ARP funds cover those programs outlined in Public Law 36-9? Are you familiar with the public law?
No.
Okay, this is the refinancing of the BPT bond.
Okay.
And the bill was passed, became public law 36-9, which appropriates $5 million of those savings to public health. And you're not.
Senator, no, I'm not familiar with it, but definitely after this, we will pull it up and review that. It's $5 million for public health. We're very much interested in the $5 million for public health. We definitely want to review that immediately after this. But we're not familiar with the 36-9 at this time.
Well, I think you better.
Yes, absolutely.
It was just sold, it was good news.
Yes, it's good news.
And the best part of it was our speaker, anticipated when we were authorizing for the bill to become law in the refinancing to ensure that public health received $5 million from those savings. So if you have not anticipated that, I think you should. I think it's going to be realized in October of this year, which means it'll go in the 2022 budget. So I appreciate if you can look into that. That's help for public health.
Absolutely.
As well,
Thank you,
$5 million.
Senator. Appreciate that.
Okay, and I also like to extend my appreciation not only to you, Art, but the people that surround you, so that you can sit in front of us confident that you're doing a great job, and it's because of the people behind you. All the staff who's sitting out in the lobby. We recognize them. It's unfortunate we can't have them all come in here, because I appreciate every year to be able to see their faces, and thank them personally for all their hard work. So to the people of the Department of Public Health and Social Services, thank you so much, and continue to be safe. Si Diyos masi, Mr. Chair.
Thank you, Senator Tella. Senator Nelson, ma'am, do you have any questions for the panel?
Thank you, Mr. Chair. Good morning, everyone. Thank you for being here today. Thank you also for the tremendous amount of work that you have been doing for over a year and a half now. The community in the island of Guam is very thankful for everything that the Department of Public Health has been doing in keeping all of us safe, taking care of our families, ensuring that we receive the care that we need during this time. So, like Senator Torres mentioned, it's something that we must constantly remember the hard work that everyone has put in, and the sacrifices that you made, and the sleepless nights that you had to lift the island up during the time I needed the most. I do have some questions. Art, in your testimony on page 9, it's just something a little bit more specific in the highlighted paragraph of the Division of Environmental Health is seeking support for the appropriation of $2.2 million, including the reappropriation of all lapse funds from 3 special funds: the Healthy Futures Fund, Environmental Health Fund, and DPHSS Sanitary Inspection Revolving Fund, to enable the division to continue providing essential environmental health services to our community. So my question is, are these anticipated lapse funds from 2021, or are you asking?
This is their budget, right? Can you double check? Just a moment.
Or are these
Senator, we're just going to pull up their budget. This is not their budget, sorry.
Are you asking to have the entire amount from the lapse funds of the special fund that we received in the government treasury as a whole?
The intent is that the environmental health had asked, and it was shaded because I actually incorporated it towards the end. And basically the request is that all special funds for public health and social services be given the rollover authority, which would include the 3 funding sources for the environmental health division. And so that really is the intent of that. And so the gray shaded parts of the testimony that you now have a copy of was really a draft, and I was going to clean it up and then send it in, but you now have a copy of it. So you got some parts that I did not necessarily speak to because I incorporated towards the 3 points of consideration for the body. And so it's really just to have that authority. And the body has given it to Public Health and Social Services, but we just want to ask to be sure that it's also contained in the 2022 Fiscal Budget Act.
And you do plan on expending all of these funds for FY 2021, but it's just a precautionary measure that you're asking that we implement the budget?
Yeah,
Okay.
because we did see a revenue loss so far, but if for some reason we generate enough, especially in the month of June is one of the busiest times for health certificates. I think it was in 2020 we generated like 500,000 just in the month of June. And so that's just next month. And so should we have some lapse, that we be able to carry those special funds balances into the next fiscal year. And we would use it for operations as well.
Thank you. In the slide presentation, you have the FY 2022 COVID-19 grant awards. And this grant award breaks down the child care and development block grants, the epidemiology and laboratory capacity. And so you have the block grants listed as 74% of what will go from this grant to that purpose, to that program. I just wanted to inquire, what was the award for the block grant in 2019 and 2020?
I'd like to do further question. Tess, if you have the amounts for 2020 and 2019 for Senator Nelson?
Good morning,
For block
Tess.
grant.
The block grant that we receive in 2020 is 6.4, the block grant that we receive in 2019 and 2020 has not been expended. The reason being is because we have an additional, because of COVID. And you know, even though we continuously pay our providers, it's based on enrollment. So depending on what the providers bill to us, we pay those. So as I've stated, we have not completely expend those. So we receive CARES Act money in FY 2020, an additional money on top of the block grant, which is 6.4 million. And then the 74% that you're talking about, we just recently received that. That's fiscal year 2021. And it's the obligation of those funding is not until FY 2023.
Right, but what did you receive in 2019?
In
for your-
2019, we received roughly 9 million for
9
block
million.
grant.
And in 2022, you're now going to receive 94 million?
That's all, that's from the American Rescue Plan Act. That's the 43 million and the 27 million that we received just recently in April,
And how-
April 2021.
How does, has public health ever met the threshold of anything beyond $50 million for the block grant within the previous years, like FY19, FY20?
The block grant is a two-year grant, so we make sure we
Utilize
expend
it.
all of it, yes.
So will
But
you be...
because of the COVID, because of the recent, the
Yes, I
enrollment
understand.
is lower, of course, if you have a claim, you pay it. If there's no claim, and besides, the admin is dependent on the expenditure. The 5% admin is dependent on the expenditure.
Okay, and the reason why I'm asking this is because during the height of the pandemic, we had a lot of constituents who own child care centers who were asking for assistance in trying to file, I guess, their forms to receive the block grant. And there was a disconnect because some of the child care centers also applied for SBA loans or the payment protection loan. And so they were saying that they were not able to receive the block grant because they were also applying for these additional loans. And so that's why I'm asking is, are we able to expend this money? And if there are other ways that we can be more creative to ensuring that we can expand the services of the program so that the development centers will be able to receive the maximum amount of the block grant, because they felt like they hit a brick wall. And they were also, as a business as well, they were also trying to survive. So I was just wondering, is there a plan like that in place? Or
The block grant money is different from the CARES Act and different from the RPA funding. So with
Right.
regards to the block grant money, we were told that we can utilize that even though there's no children there,
Right.
just to pay the enrollment. But unfortunately, if the parents are not enrolling their children, we can pay whatever, only those that are enrolled. So it depends on the invoices of the child care centers. With regards to the CARES Act money of 6.4 million, we have sub-award. There are regulations. They have to apply for system award management registration and all of those. We do continuously pay them. And so, but they have to meet the requirements of the grant in order to receive it. We are in constantly communication with ACF as to how can be creative, how else we can spend that funding. Unfortunately, we still need clarifications from them with regards to the 43 million and the 27 million. The 18 million that we received, that's an additional. We already have a plan of utilizing that. We're also going to do a sub-award grant. Yeah. And we're requesting from ACF if we can do a 2-year sub-award grant so that the payment is continuous. Yes.
thank you, Tess.
Senator, if I may, I'm sorry. Just to add on to that, some of the questions you asked is something Tess and I are exploring, and so there is a tentative meeting for next week that we're requesting to meet with ACF to discuss the very issue here, is what can we do with these funds? They gave so much money to CCDF. There must have been some logic behind it in the U.S. that either they just have so many more children in child care centers or we're missing something. And whatever it is that we possibly may be missing, we want to find out next week. So one of the conversations I had with Tess on this was, what if we could refurbish the playground of the child care centers? But her last response was that's not an acceptable or an appropriate expense. So we said, hey, let's call them and let's find out, is there something here did we miss a paragraph? Or is it really just that it's just as we understand it and we stand to lose millions of dollars because we don't have people enrolled and the expenses aren't at the level of the funding? But if we can diversify, we talked about public playgrounds where kids go. So we're very open with that conversation. We just hope ACF would be as well. And so that's who we're going to be meeting with, I think, next week. It's still tentative. We're looking at 9 o'clock Tuesday morning. We're just waiting for confirmation. And Terry, Laurie, and I will be at that meeting with Tess. We just want to really hear what they have to say about these funding streams.
Thank you, Director.
Absolutely.
A question on the Medicaid payments. First of all, I want to thank you, Tess, for all the hard work you did to ensure that Guam received the maximum amount of Medicaid funding for the program. And we understand the complexity of the formula, and even though that the cap is lifted, we still have to fulfill a certain match. And so I think not a lot of people are understanding that. Can you just explain that a little bit further?
Okay. Basically, as a result of ACA, we received 268 million. And so towards the expiration of ACA, we were not able to expend all of it because of the local match, because the local match is 45%. So what happened then is, through Congress, they increased the federal medical percentage to 100%. So we were able to expend all the ACA, and the following year, they were also able to increase the FMAP to 83%. So basically, 2020 and 2021, the federal percentage is 83%, which requires 17% local match. As you know, we cannot draw down the federal funding without the local match. So as a result of COVID, we have an increase of 6.2%. So for this fiscal year, our FMAP is 89.2%, so the local match that's required only is 10.8%. But there, depending on the category of Medicaid, there's childless adult, there's also CHIP, there's also EAP. So the federal medical percentage of each of those programs are different. As you know, we expanded the Medicaid program to include the childless adult. So initially, the FMAP for that is at 80-some%, but the maximum FMAP that we can get for the childless adult is 90%, which requires only 10% local match. So every year it changes, but then again, it's based on Public Law 11694. So because that's only up to fiscal year 2021, come fiscal year 2022, we're back to pre-Public Law 11694. So our federal funding would be 55%. And at the same time, it will go back to the original Section 1108 funding, which is back to 19 to 20 million for next fiscal year. If we're going to, though COFAS, everybody knows that COFAS will be eligible under the Medicaid program. That funding, there's no cap for that funding. We can request any amount that we need for COFAS, but it still will require 45% local match.
And is COFA related to MIP?
Yes. Currently, we have roughly 8,000 COFAs under the MIP program. And we submitted our statement amendment because for the territories, it's optional. But we did submit our state plan amendment for it to be effective January 1st, but we haven't received the approval from CMS with regards to that.
And are we anticipating our MIP to be covered by the federal funds?
Yes.
So even in future years, will the MIP payments for $2.630,100 million, $2.6 million. So the MIP payments that you're asking, this will not be covered by federal funds then?
No, the MIP, it will be, depending. There's two funding sources on the MIP. There's the 2 and the 10 million. So if we shift the COFAS to the Medicaid program, we can utilize the MIP funding to match the 55%.
Okay.
Yeah.
So, Mr. Director, are you still going to need that $2.6 million for your MIP payments from the Healthy Futures Fund if we are going to offset it by moving it into the...
Well, you know, Senator, what I would say is yes at this time, because we need to first get into the system, and it's premature right now. We don't know what numbers we're actually going to be looking at. So I would say yes at this time.
Okay.
And stay with that number for now. Thank you.
Okay, thank you. Just 2 more questions. You know, the question about the social workers and social worker pay was brought up. And so we were just kind of doing a breakdown on the DPHSS staffing pattern. And you have administrative aides and administrative assistants at the level and step of J9 and F12. You have an administrative aide at the level of F12. And they're making $33,859. And then you have an administrative assistant at the level of J11 making $44,014. And so you have the social worker L1 who falls in between the two and is making $37,100. And so I wanted to inquire, what are some of the skill sets and requirements for your administrative aid and or administrative assistants? Because I understand for social workers, they have to have a degree, they have to have certain certifications, or they have to work towards that certification. Do the administrative aides, are there also degrees required, or is this something that you just come out of high school and you get hired and then you work your way up? I mean, what is the requirement?
You're correct, Senator, on the latter part, that they're working their way up. The position grade and number, basically someone at J11 has been on that position for quite some time, because for the first, perhaps, first 7 years, I believe, you're going annual increment. So that's about 7 years of service. But when you go from 7 to 8, 8 to 9, and 9 to 10, that's 18 months of service, right? And then when you go past 10, it's 24 months.
Right,
so
before you get your increment.
they've worked their way through that salary, and that's part of their, I guess you would say, their seniority, right? And so social workers, SW1, you said starts at $37,100. What we do have in place for that is, if they perhaps graduated from the School of Social Work at the University of Guam, they are able to start right off at a social worker 2 level. But yes, this person, when we recruit, is typically a social worker 1, step 1, and that's how we do recruit. And so even with a J9, that would also be someone who's been there for more than 7 years, because it's already a J9, probably 10 years or so. And so that would be just through time on the job with public health or just with Government of Guam. In terms of the requirements for administrative aid and assistance, ma'am, I'm not familiar with their job requirements, but I do not suspect that the administrative aid would require a college degree. I'm not sure about the administrative assistants. I would think perhaps possibly not as well, but I'm not certain. I would want to look at that to be sure and give you a definite answer.
Okay, yeah, that was just, you know, perhaps taking a look at the requirements for the job positions and making it equitable to the requirements that they fulfill, or the degrees or the certifications that they have achieved. I did have one more question.
Sure.
But I forgot it. Yes, well, thank you very much for everything that you've done. Thank you for staying here all morning and giving your time to help us understand the budget more clearly. And thank you to the members and the team at Public Health and in the homeless shelters for the extraordinary work that they do for our community. Thank you.
Thank you, Senator Nelson. Senator Chris Drainage, do you have anything, sir, you want to ask the panel?
Caesar's Monsi, Mr. Chairman, and yes, sir, I do. At the outset, I want to join all of the senators in this body who have recognized the COVID warriors that you've really been at Public Health and really throughout our entire health system, but particularly from Public Health. It's a tremendous amount of work, and we're grateful for all that you've done. Joe and Terry and Tess and Tom and Ms. Duenas and all of your team that's joined us today, and all of those who are out there doing that work now. You know, I joined the speaker, and I just have to express that I'm a little concerned. While I do understand this one-time opportunity and the judicious use of the rescue funds, I'm a little concerned in the general fund area. And the reason for that is, you know, as the speaker mentioned, you know, although I wasn't a member of the 35th, I watched closely a lot of the budget deliberations. And it was very arduous what transpired and the back and forth on who's supporting and who's not supporting. And Tess, you know, your team, all you guys, you've done a wonderful job. And the reason why I don't want to go into detailed questions is because my colleagues have really covered that in your presentation, covered that as well. But Art, I guess my first question would be, in the general fund, as the speaker has pointed out, was there any CARES funding that supplemented the general fund for fiscal year 20? Or 21, I guess, is what I'm saying.
Well, you know, some of the funds were being used, absolutely. Like we are using some of the CARES Act money for services for the seniors, and that's pretty equally distributed throughout the department. If you have CARES money, we're looking at what those funds could be used for, even for general operations or specific operations within FY21. And some of that is actually being able to be used for that. So, like we have nurses hired for now in terms of vaccine, quarantine facility, isolation facility, airport processing, and testing. And we're using a lot of our funds from these grants for response to COVID-19 for that. I'm not sure if that's what you're asking, Senator, but...
Yeah, what I'm trying to figure out is that, you know, I mean, we're going to have to work with the chairman, and I'm sure he has this concern as well. If this pattern is continuing throughout, I guess we're figuring out now what the governor's plan is, because we asked the governor what was their plan with the rescue monies, right? So now we're seeing this $17 million. Essentially, under some circumstances, would be considered supplanting, really, simply because you're going into general fund appropriations where you normally would have funded that out of your general fund revenues, tax revenue, tax base of the Government of Guam, and you're inputting that number there to cover. And so I was just trying to see if that's already been established in your fiscal year 2021 under the general fund. Have you been backfilling revenues into programs set aside for the general fund with CARES Act moving into now looking at the rescue fund doing the same thing?
Sure. With regard to that, yes. With what we have in terms of, like for example, aging services, we have an overmatch in the millions for services for our seniors. So that not being available in the year in 21 and potentially in 2022, we are using the funds. And those funds were here and provided to the division to augment their existing funding level. And I know that the current acting administrator is in regular communications with her project officer, and I'm quite certain she's expressed what we're using the funds for. And at no time has there ever been a concern, Senator, that we are supplanting. But definitely, yes, I'm aware that we are not going to be identifying local expenditures that need to be local expenditures to supplant with federal dollars. what we're looking at in terms of, like my earlier example, is the email address and the platform to have employees have access to email, is that is a reasonable charge that can be assigned to programs as they plan for programs. And they have 10 employees, they have 10 phone lines, they have 10 internet email addresses, and they could subscribe to the director's office and say, we have new employees, we have 8, and we would charge them accordingly based on the number of employees assigned to that. And that we feel is reasonable. We're not supplanting because this is actually an operational expense, and they would also write it to their grantor and be subject to their approval. Wouldn't we just doing arbitrarily? We don't operate arbitrarily like you're going to take this charge and charge it. We always ask them to check with their grantor. Sometimes we get a yes, and sometimes we get a long wait, and sometimes we get a no.
Sure. So, and so that'll be important going forward, Art. And,
Sure.
and I know your team understands this, and I know you understand it as before being appointed as a very capable director, and with your team, you also have the history of being in the agency, knowing that you always got to be careful when you budget, and when you accept the fact that you're going to get such a lower appropriation from the general fund revenues. Of course, this can all be asterisks, and it's an anomaly situation, no question about that. But there are times when they use that 3-year average, and it comes back to bite the agency and the department, and we don't want to get in that exercise of being at the legislature, being the bad guys, or who's the bad guy, who's the good guy, because when you talk about your general fund, this is your core of what you do, and the core of what supports your mission. And so I will look with the chairman and, of course, the oversight chair to see, because I'm sure this wasn't your original ceiling as of January, because there was no expectation of what the funds were going to look like under the current president's allocation and what came to Guam under the rescue plan. I mean, was this your original ceiling request in January?
That was the only request. I mean, we worked with BBMR and got to the numbers that we got.
Okay, so you were already anticipating in your original request that you were going to be looking at some sort of bailout from the federal side of 17 million. You adjusted your general fund down on all of your categories here. That's how we arrived at this 17 million.
Not at that time.
That's what I'm trying to say, because the exercise here is what Office of Finance and Budget has done. That's why we have these numbers to ask you, the question of, okay, this is a big difference between what would have been the original adopted ceiling to where we are now. Now, of course, like I said, we've definitely we've received these funds. We're going to all work together on how to use them. But this is definitely, now moving into the realm of we're appropriating now. This is what we're doing now, is we're appropriating the funds that have come come in for the governor to use to work with how and she's asked us to work with her on how to use these funds. But now it's come into the level really where this is now an appropriation, other than just a direct. Because if you really look at it, Art, a lot of the idea behind this funding was to augment and to help your operation going forward with traditional and shortfalls that you've expressed in areas where you've discussed you've chronically needed this assistance. Now we're into the general fund area to where we're basically appropriating now that money that's come. And that's kind of interesting too, because we've had this back and forth with the governor's office, and this is not unique to this situation, but whether or not you have the ability to appropriate. Now we're appropriating, because that's what this exercise by Office of Finance and Budget has done, to say that this disparity in the request and your authorized levels is actually reflective of rescue funds that are now being appropriated by the legislature. Okay, I just wanted to be clear on that, because that's our exercise, Art, and I'm not trying to pull you into what we're going to have to do in terms of working with BBMR and how this is all going to reconcile. But I'm sure the oversight chair and the chairman, are going to have to look at this in its totality. It's a great savings to the government of Guam, no question about it. But going forward, always be cautious when you come to the legislature and put your general fund request at this level, because this is the core of what you do, and we always ask you what you need. So we're appropriating now. That's what we're doing. Art, thank you, and your entire team. I just have two more questions because it's part of your testimony. And once again, this goes into the executive operation, right? So you, on page 11 of your testimony, further, we asked the following provisions: no application of the 15% reserve for any funds appropriated to DPHSS and FY22. Was that authorized by the governor's office as part of your testimony?
I have to say this is my testimony, and this was a position I had presented this morning. So I can't say that it was no. This is my position as the Director of Public Health for my operations.
Okay.
For the operations of the department, I would ask consideration that all our funds not be subject to the 15% reserve. It has really hampered our operations.
And I'm glad you said that, Art, because I'll have to work with the chairman. I've done many budgets. I don't know that we've ever enacted this as part of the budget, simply because that's an exercise of the fiscal team's duties and responsibilities as they see fit at the front office. But that's why, once again, you presented this to the legislature. We're going to have to discuss this because that's a tool usually used to manage funds. But I agree with you. I agree that there are critical areas that really should be exempted many times from this tool, at least at 15%. Maybe 5, that's workable, but 15 for the critical areas sometimes is very concerning. And so the last is on the rollover lapses on general fund and special funds. Is that part of your detailed budget request, or is that in addition to what your request would be?
This is just for the funds that have balances in the current fiscal year, that we be able to and be authorized to access those balances into the next fiscal year, especially with our special funds, so that we don't lose that. We want to be able to have what we generate to be used for public health. Environmental health is a good example in which many of their operations are funded through these special funds. And as much as we'd like to generate more and provide them even more support, a lot of times we go within what they project. And so if they project X number of dollars, but they're closing the fiscal year, let's say with 100,000, we can safely look at funding additional 100,000 expenses. Maybe it's the acquisition of a vehicle, maybe it's the acquisition of new computers, but we'd be comfortable doing that because we know we have a balance into the next FY.
Excellent, Art. The reason why I ask you is because I definitely do understand that on the special funds. But once again, with the chairman, we'll work to see how this is going to work for this fiscal year. But with general fund, of course, generally what happens is, once again, BBMR and other fiscal members will use that as well as a tool, because lapses sometimes don't end up where they originated from. But once again, we'll work with the chairman on that. Art, I want to thank you once again and your entire team, and we're standing here to support you. And so we'll see how this goes forward. We are going to make sure that your general fund request, however it works out here, will meet what you need. And so that will be between us and, of course, the overall budget. But regardless of where this ends up, I know that everyone down here stands in support of what you're doing. So Sijus Masi again, your entire team, and thank you very much. Sijus Masi, Mr. Chairman.
Thank you, Senator Duenas. Senator Perez, do you have any questions or comments for the panel?
Thank you, Mr. Chair. I think a lot of the questions are asked, and I know it's the morning has become the afternoon now, so good afternoon to all the panel members, and thank you for being here and preparing for this budget hearing. I think just generally speaking, I think, whenever a budget is presented, my thought is it sufficient to support the needs of the agency? And, looking back at the pandemic, who would have thought, right, that we would be having to respond to something so large, and that your agency was able to, put out the fire, so to speak. And I think, it's important to also balance perhaps the more of the long-term health needs. And I'm just looking over some of the OFB documents here, or actually BBMR documents, and I'm still seeing the trend of non-communicable diseases, and I know that's kind of taken sort of the back seat to the pandemic. But if you can maybe speak to what the plans are with this budget, do you evaluate or assess that it is sufficient enough to address the non-communicable disease part of this?
Senator Ramirez, I'd like to ask and give the opportunity for our staff from Public Health to come and speak on that matter. Would you be agreeable to that, ma'am?
Yes.
Great.
Yes, please.
Thank you. I'll be right back. Thank you.
No, they're going to bring somebody in to answer that question. And before he testifies, Sergeant Arms, please have him sworn in. The gentleman sworn in.
Under penalty of perjury, do you affirm that all information you're about to provide today will be the written, electronically, or in writing, be the truth, the whole truth, and nothing but the truth, so help you God? Mr. Chair, he's under oath.
Thank you, Sergeant Arms. Sir, if you can please identify yourself, and if you haven't heard the question, if I ask Senator Perez to please repeat the question.
Yes, thank you, Mr. Chair. Did you need the question repeated, or?
Yes.
Okay. Yeah, so my question was how is the Department of Public Health going to address the non-communicable disease part? I know that a lot of the focus has been on the pandemic response. Thank you for that, by the way. And just want to also kind of shine a light on this other part of the Department of Public Health that's so important.
Good afternoon. We will continue the preventive programs that we have for...
Sir, please state your name so everybody will know who you are. Thank you.
My name is Chima Mbakwem. I'm the Acting Chief Public Health Officer for the Department of Public Health and Social Services. And to answer your question, ma'am, we actually have preventive programs that have been ongoing before the pandemic. What happened was during the pandemic, programs did not stop, basically, but people did not have access to those services because of the community quarantine that was in place. So we are going to continue those services and then look at the lapses from the year before, and using those numbers, we can project on what other kind of services that we need. But the reason that we might be seeing increased cases now is due to late diagnosis, because people were not going to the clinics in the past 1 year. So we might see a considerable increase within the next few months, then we'll see a decrease when they start assessing treatment. And basically, most of those non-communicable diseases will focus on preventive care, which would also involve exercises and medication. So we are sure that we will be on top of it.
Great, thank you. So what I'm hearing is that the lapse funds, in addition to what you have currently in the budget, is going to address the non-communicable disease part. Is that correct?
Yes.
Okay. Okay, thanks. Okay, this is just, I guess, another question. So I'm looking at the overall budget summary, and I'm seeing about 15 million of the 97.7 million is going to personnel costs. That equates to about 15% of the budget. A big portion, about 68%, is going towards miscellaneous. And if you can explain maybe Tess or Director, I mean, I'm assuming it's direct assistance, but if you can explain what that 67 million is for.
So basically, on the miscellaneous part, those are for payments to for Medicaid providers, for payments to MIP providers, payments for foster care parents. Those are the miscellaneous that we do have under 290.
Great, yeah, I assumed that was the reason. So it's going to direct assistance and not
Yes.
towards the operational cost of
No,
Department of
the
Public Health.
operational
Okay.
cost is totally different.
Okay, thank you. And then I guess just other questions clarification questions. Let's see, the overmatch. So, Director, you mentioned the word overmatch. Can you explain what that is?
Absolutely. So most grants or many grants will have what we call maintenance of efforts. So it would be your match required. It could be 50-50. And then the local government has the option to go above that match. And that's what we would consider an overmatch. So in a $100,000 program where 50% is federal, 50% is local, but the department or there's an effort or initiative or law that says we'd like to add on another $50,000 to this effort to really expand this program service. So the additional 50, which now makes it 150, is the amount of money that is overmatched. And when you report the MOE, you want to report it at the required match. In most grants, there's a term and condition that if you report your match at 100,000, that you would be required to maintain that level of match. So you really just maintain the MOE, which is really what the grant is asking you to maintain, is just submit what's your maintenance of effort, and anything above that, we would classify it as an overmatch.
Okay, thank you. Can you carry over the overmatch to help with the
You know,
match?
it can depending on the grant. If, for example, there's some grants that are 2-year cycles. So once you match and you obligate it, the local funds become obligated, and as long as you don't liquidate that contract, you can charge against that contract in year 2. But the federal funds itself can be obligated within the 24-month period.
Thank you.
You're welcome.
And as far as accounts payable, do you have a record of how much is in your accounts payable?
You know, I don't have that. My ASO, who stepped out for a few weeks to have Chima step in, would probably be the better person to answer that. I could ask him to come in, and I could do that if you'd like.
Yeah, we can ask. I can ask later. So.
Okay. Well, we could actually send that to you, Senator, if
Sure.
you'd like. Okay.
Yeah, that'd be great. Thank you.
Let me just add that on.
And as far as lapse funds, total amount of lapse funds, what is the total amount? If you were to base it on quarterly amounts.
Do you track it? You want to maybe, Senator, perhaps we could ask Mr. Tidigo to come in. So they're both
Okay.
fiscal concerns, yeah. And
Okay,
so
thank
I'm
you.
not sure how they're tracking lessons. No, we'll call Tommy.
Would you like me to repeat the questions? Okay. Thank you, Mr. Tidigo, for coming back. Yeah, the questions that I have is, do you have an amount on the total accounts payable for Department of Public Health?
No, I don't. Our accounting, we work with the DOA, Division of Accounting. And so it's really dependent upon the bureau or the division staff that have outstanding payables to work with the Department of Administration in addressing other
Okay,
payables.
Thank you. I'll follow up with that. And as far as the lapse funds, do you have an estimate of the total amount of lapse funds?
No, I don't. Current total? No, I don't.
Okay. Is that something that you can provide for the committee?
Yes, I can work with you and provide you information.
Okay, great, thank you. And then just maybe one last question. In your presentation, I was very concerned about the statistics related to the staff and the breakdown of employees by length of service and those above 25 years and above. So which departments are going to be hit the hardest, or is it evenly distributed? Or divisions? Which divisions are going to be most impacted?
Yeah. That's undetermined at the moment.
Okay, so maybe a follow-up. You can provide the follow-up answers for that. I appreciate that. Yeah, so that's a big concern for me as well. You know, how to ensure the continuity of services when the staffing is probably in jeopardy. So I think, I think those are pretty much my questions, and I do appreciate any follow-up answers. Thank you, Mr. Chair.
Thank you, Senator Paris. Mr. Art, just prepare your response and then send it to us, and then we'll provide it to all. Yes.
May I just ask clarification, though, of Senator Paris? You're wanting of the 98, is that, I just want to be sure we're on the same page, that of the 98, you'd like us to break it down by division?
Yes.
Okay.
Yeah, those that most likely would retire, I guess, they're getting close to retirement.
Okay.
Which divisions are the ones that are most impacted?
Okay.
Yeah.
Yeah, thank you for that clarification.
Yeah, thank you so much, Director, and everyone.
Okay, thank
here.
you. Senator Nelson, you got that recall, that question you had?
I did. Thank you very much, Mr. Chair, and thank you for your patience, Director, and everyone here today. The question I had was, you mentioned that the social workers work extremely hard and they even work outside of their normal hours. How do you compensate them if you don't have the funding to compensate them for overtime?
So a lot of that is managed at their operations or program level. So what some have done is they would shift their work assignment or work hours. And so let's just say, for example, someone works tonight till 6:30 because of a case that they're responding to. They should be able to work with their supervisor, say, hey, I've got an hour and a half left that I've worked a little longer today. I'd like to request to come in at 9:30 tomorrow. And so really it would be an arrangement that we would have with the respective areas of operation. And that's what I would hope. Yes, I believe social workers are exempt, but I would really not want to just take the practice that just because everyone's exempt, that there's no consideration given to employees who work extra hours and perhaps want to take a 30-minute extra lunch tomorrow and be docked pay for that. We should be able to manage that internally.
Is that an optional form of compensation, or are you requiring them that that's the only way that they can make up for the time and hours that they have worked?
I've never really set a policy. I've actually left it up to the program level and division heads to manage that. I've not put anything in policy in writing about that, ma'am.
I wonder if I would be overstepping if you could implement a policy that allows that to be an option for them and for them to receive pay also for the overtime. So if you're going to work overtime, you may opt to either use it for compensation time or that you may use it for your pay for overtime. Just because we have a lot of people in the government that are working overtime and they do get paid time and a half. And I feel that if we're really stressing the importance of social workers, I mean, they deal with patients who have experienced extreme trauma or clients who have experienced extreme trauma, like sexual abuse or domestic violence in the home. And I think that that would also be weighing on the social worker as well. And if we're able to do time and a half for people or for other jobs that are in the government, perhaps with the lesser stress spectrum, I think that would help resolve some of the challenges you're seeking about this pay increase, because you're still not making up for the disparity of work compensation. And then secondly, if they were to do this compensatory time, are you going to allow them to use it to travel off island if they need to? Or do they have to do it within the work day and they can't take like compensatory time, leave, departing off island for pay. If that's another option because you don't have the revenue to allow them to, because I don't know what the policy is, right? You leave it up to the managers, but I think that this would be, this would perhaps be something a little bit more fair, because I know that if I'm working for my supervisor, I'll probably get directed just to come in 3 hours late. Because, you know, you're looking out for the funding.
No, Senator, I thank you for the points you're making this afternoon. I would though have to discuss this with DOA just to be sure that whatever policy we put in place for social workers and how that will not necessarily be limited to social workers, that putting a policy like that may actually have implications throughout the department. So I would want to discuss it with DOA just for their guidance to be sure that what we put out in writing is something that we can fully support. If it's compensation, time off, and really if there is time off, to what extent can they use that time off? Is it within the week? Is it off island as you stated? So we can define the parameters of that policy.
Thank you. I would really, I'm sure the social workers would be very grateful for that too.
Oh, yes, I'm sure they will be. Yes, absolutely. I think, Tess, you wanted to add on to? No? Okay. I wasn't sure. I thought I saw you. Thank you.
All right, thank you, Senator Nelson.
Thank you, Mr. Chair.
All right. Madam Speaker, you had some points you wanted to address, and then we'll wrap this up.
Thank you very much, Mr. Chair. Just 3 points. First of all, if I could, just clarify that Public Law 36-9, the $5 million from the refinancing savings, we had outlined that it would be for food, because at the time and up to now, we're still seeing long food lines, and we know that, you know, the employment is not back to where we are hoping, and so, and then we just heard recently that another one of the food programs is ending in May, so that was to help to get some food distributed. And I wanted to go back and, you know, we talked about, some of my colleagues talked about the budget last year. So last year's budget, as you know, was quite contentious. It was, in fact, vetoed. And one of the main, you know, contentions was that public health was underfunded. You know, but if you look at the spreadsheet by OFB here, public health was receiving about $11 million more from the general fund from the prior year. That's what they received in last year's budget. They also received $2 million more from the special funds than the prior year in last year's budget. And so while we overrode that budget, you know, public health told us they were going to shut down services and things like this. And the last thing I want to see this year is that kind of, you know, I don't know, political back and forth. I don't think that's necessary. And I'm so concerned because now you're coming in here with a $17 million less request than last year, which you said was not enough at the time, right? And so I want to know, you know, when we were in the budget process, you know, we tried very hard to fight for public health, to get a little more money, to find other places to transfer that from, other agencies. And, but it was very difficult. But one of the things we were able to do was allow them to use FY20 lapses. So I want to know, at the time you could not tell us exactly how much that was. And I want to know now if those were used, were you able to use your FY20 lapses in FY21?
Yes, we were. In fact, it provided for a lot of the shortfalls in the programs for the aging.
Do you know the amount?
I don't know the exact amount, but I believe I can. One moment, okay? Well, it was a mix of different funding sources that we were able to reduce the number. But initially, when we provided the 10.4, you know, the notice that we were going to be, the shortfall was identified at 10.490 million, right? That was all. I continue to monitor that, and to this date, we should be able to provide for the.
So did you say you used about 10.4 in FY20 lapses during FY21?
I'm not sure.
Oh,
I don't have that.
What about you, Tess?
It was reduced from needing that much to a much less number because of the assistance that was provided through accessing the funds that were lapsed or accessing liquidated obligations. So, and to top that off, we also were able to utilize what was provided through the CARES award.
Right. So I guess I do want to know, though, how much you used in your FY20 lapses. You're asking for the authority again to use FY21 lapses, and I'd like to know why, I guess, why you were not able to expend those and how much you're looking at. And if you don't have those numbers available, I know that fiscal year's not up, but you must have an idea if that's what you're asking for. I guess that's what I want to know. And Tess, I know we had a lot of back and forth regarding the Medicaid lapses, and we wanted to ensure that you would be able to use all of the Medicaid lapses from prior years. And I guess I just want to double check, were you able to do that?
Yes, I would be able to. I'll work with it and work with the division heads as well as with DOA to produce a report to you.
All right. Tess, can I just ask about the Medicaid lapses? Were you able to utilize those as we intended?
At this time, not at the moment. The reason being is because we're utilizing the appropriation for fiscal year 2021. And so with regards to 2020, the account hasn't been established. We submitted it to BBMR to establish the account. So based on that, for sure we're going to utilize it if we're able to transfer the COFAs to the Medicaid program, and at the same time, we increase the income guideline of Medicaid to 150% of the federal poverty level. So, and that's effective January 1st. So depending on the claims that we are going to receive and depending on the services, utilization of services by the clients, we may not, or we may. So it's all dependent on the claims that we do receive from the providers. Just to say, we're very much up to date on processing the claims. We're processing May claims. So we're asking the providers to submit the claims if there is.
Okay, thank you. You know, I have a lot of faith in public health. I very much believe in what public health has been established to do, and that I want it to be full force out there in the community and continue to do this. I think we've seen in the pandemic, you know, public health go way beyond what you know, the call of duty, the expectations. And so I want to thank you all for that. But I'm, you know, if you guys were coming in here with the 17 million, we found savings. You know what I mean? We found ways we could cut our operations, $17 million. We would be commending you, right, for that. But what it looks like is we're cutting what you're describing as things like foster care payments, $2.2 million for BOSA, Department of Environmental Health, $7 million in aging services, and some of the other things you listed, general operations. That's pretty mind-boggling to me that anyone would come in here and say public health is not going to be the top priority in a budget for the government of Guam. And these are sounding like necessities, and if they're not, I very much want you to be honest with us, because we are hoping to use, you know, general fund monies for the necessities of the government and ARP monies to expand beyond public health's current potential, not just to fund your current operations. We want you to go beyond that with this ARP money. We're trying to change the standard of living on Guam. We really are, and we really want to expand all the good work that you are doing and really make those dents in those continuing diseases, the you know, lifting these people up out of poverty, so we don't have to continue the poverty programs, but let's really find the ways to lift them out of it. So that's what I'm hoping with this ARP funds. And so if this list that you gave us, Art, and you're going to provide in writing of how you're intending to make up, or, you know, what you've allocated to ARP, I mean, they sound like necessities to me. And I guess I want to be very clear whether those are, and those were funded in FY21, why we're not going to be demanding that today. And, but I know that the chair has showed me that the 57 vacancies, I think that those should be covered by the current request, so that's good. I want this to be filled. We want it throughout the pandemic. We had several oversight hearings checking, are you expanding permanently your environmental health section? Are you expanding permanently your ability to trace these contagious diseases, right? Beyond COVID, are we going to have that permanent type of capacity? All of that. But I know the chair has asked that we just work together going forward, and that we need a shift. I don't believe, because we're looking at each of you, and you know, I saw all the good public health employees in the hall. There's a lot of them here today. There's a lot of them out there on the front lines today. But I feel very bad that you're coming in here to say, give us less, as if, you know, they're worth less. That doesn't make any sense to me. And yeah, I think, you know, when, you know, the deputy director again is talking about CPS and the things we could do, that's what you should be in here doing. You should be in here demanding that beyond what we can currently do and with the money we need, beyond that, we can make adjustments to how we recruit, we can make adjustments to how we retain, and for those improvements, we need additional money, not less. And so, you know, I don't want you to, anyone to feel bad about what I'm saying. I want to say, I want to stand you up to your full potential. I don't want to take away from that. I don't think you should do that to yourselves. I don't think that is, I don't want our budget to show that public health was cut $17 million, because that just sets you up to come in here every year after this ARP fund runs out to beg for your $17 million for the necessary services, especially foster care payments. I mean, those kind of things, I just can't understand that at all. So if you could please, if we could just work with the chair. Mr. Chair, I thank you for your cooperation and all of that. Thank you. Si Diyos masi to all of you again, and thank you for all your hard work. And please, let's work together and let's get you what you need. Si Diyos masi.
Thank you, Madam Speaker. And thank you, colleagues, for participating today in the budget hearing. And Mr. Agustin, Art, my office will be working with you. We're going to figure out what we need to do. And when the American Recovery Plan, the money gets flooded out or identified to be flooded out, then we'll work with that. But, you know, we want to make sure that the people of Guam are protected. Your office does what it's supposed to do. That's our focus. Do your job, let us do our job, and let's make it work. Okay? The committee will continue to receive testimony. Please address your written testimony to the Committee on General Government Operation, Appropriations, and Housing, and submit it via email to Senator Joe S. San Agustin at gmail.com, or to my office located at Rand Care Building, 2nd floor, Suite 3, 761 South Marine Corps Drive, Timoni, Guam. Si Diyos masi for attendance and participating in today's hearing. And for those at home, thank you for watching. The budget hearing on Bill 55-36-2R, relative to the Department of Public Health and Social Service, now adjourned at 12:55 p.m. and we'll be back here at 2 o'clock for the Guam Memorial Hospital Authority. Thank you. Have a nice day.